ready? Are you ready? You are ready. All right, thank you very much, honorable members. We will continue with Ministry of Health. And the next infraction is about rent payments. Paragraph 96 of the report. According to the auditors, the ministry pay rent in amount of 2.8 million Ghana cedis out of the COVID fund to PSB Realty Company Limited in respect of store and office accommodation for interim temporary central medical stores. Now, the auditors are saying that the Deputy Financial Controller, I think of the ministry, indicated that after the old medical stores in Tamar got burnt, there was a need to get a place as temporary medical central stores, central medical stores, to store health commodities. Hence, the 3 industrial warehouses were secured in a prime area on the Spinters Road. The Deputy Financial Controller added that the cost involved was industry standard, determined mainly by its prime location, its security, and proximity and convenience. The auditors recommended that the Chief Director should, as a matter of urgency, engage the Ministry of Finance to secure a permanent office accommodation and store space for the central medical stores to avert the payment of this uneconomic rents. Management responded that indicate that the work on the reconstruction of the original central medical stores in Tamar has commenced with procurement processes completed. It also added that the contractor has been mobilized to sites, design completed, demolition completed, and work has commenced on the substructure. So, first of all, I want to find out, when did the medical stores got burnt?
Honorable Chairman, it happened in 2015, but we can't state the exact date.
2015.
Yes, Chairman.
So the ministry have to wait until 2020 before you be using COVID money to rent a place. Ministry of Health. Why? The place got burned in 2015. 5 years down the line, nothing was done in order to secure any other place. So why were you storing your commodities, health commodities, until COVID in 2020?
Mr. Chairman, let me refer this question to the procurement director.
Okay.
Honorable Chair, thank you. In fact, we secured the temporary warehouse in 2015 because of the exigency of time and then the commodities, health commodities. So it was 2015, Honorable.
But this is 2020, COVID.
Honorable, yes. We were paying to GOG.
Yes. Then when COVID came, you decided to pay with COVID money.
Honorable.
COVID has suffered, though. So the 2.8 million that the ministry paid to rent the space, is it for only the 2020 and 2021, or it covers more years?
Mr. Chairman, it's 2 years.
2 years.
Yes, sir.
So what is the current situation now? Are you still occupying the warehouses?
Mr. Chairman, yes, sir.
And how are you paying for it? How are you paying for it?
We use GOG.
You are back to GOG.
Yes, Mr. Chairman.
Auditors, your recommendation that the Ministry of Finance should provide funding for a reconstruction of the Central Medical Stores, no action has been taken on that. Or you have started the construction. You stated that the contractor has been mobilized to site. What is the status of the project now?
Honorable Chair,
No, this one I'm asking the Ministry I have.
Chair, yes, we started in earnest, but work has stalled.
What is the current status?
Mr. Chairman, let's refer to the infrastructure that to
Okay.
address that, then I'll come back to it.
Honorable Chair, thank you very much. Just like you rightly indicated, this project actually started moving on smoothly until we had this issue of the debt restructuring on our hands, so it's been stalled for the time being. But just about last week, we also wrote another letter to Minister of Finance trying to make an appeal to, fund this particular project from their, from the ABFA to be able to continue with the project, just like they've arranged a similar financing for the maternity and children's block in Kumasi.
Mr. Nkansa, how does the debt restructuring affected the project?
No, it was one of the loan. It was a loan that the ministry, and for that matter, the Ghana government actually contracted to do 4 facilities.
Okay.
Tema General Hospital, Doma Maternity, and then in Kransa District Hospital, together with the Central Medical Stores.
Okay.
And out of that package, because of the debt restructuring, the contractor were not being paid, so the project has been put on hold for now.
What is the current status? Does it mean that the financiers still don't want to?
No, I think that is why I'm saying that the contractor, we had a meeting with the contractor last week. He's indicated his preparedness to try and finish the CMS because we indicated to him that it was quite a priority area. The truth is that he's doing a prefabricated material to do a pharma grade, a new central medical stores for the ministry. So that is why we've written to Minister of Finance. We indicate to them that this is one of our priority projects, so they have to try and fund it outside the loan portfolio. Thank you.
Vice Chairman.
Thank you very much, Mr. Chairman. How much would it cost to rebuild this central medical stores?
Mr. Chairman, it's $15.5 million.
15.
Building a fully pharma grade central medical stores.
Now we are paying 2.8 million. Is that for a year or 2?
2 years.
2 years.
It's Ghana cedis for 2 years, please.
Yeah, I know it's Ghana cedis, but we've been paying since 2015. So for 9 years, we've been paying 2.8 million for every 2 years. Is that it, sir?
Yes, please, sir.
I'm just curious. Who owns that building that you are paying $2.8 million cities to rent?
Anyway, Vice Chairman, the $50 million for the Central Medical stores, if you convert it into city now, it's a whooping 240 million. I use 16 Ghana cities. All right. Paragraph 101, Honorable Johnson.
Thank you, Chairman. That has to do with payment of advances beyond threshold. I believe you are aware of LI 2378 of PFM Regulation 113, which allows you to make advance payment to covered entity of goods and services, but it should not go beyond 15% of the total cost of the contract. You went ahead and paid a total amount of $27 million and $9 million to 10 suppliers, cities, yes, 9.9 million cities to, no, the second one is, yes, the first one in dollars, the second one is in cities. Yes, to 10 suppliers and service providers. And the details of the transaction is found in page 31, 32, and 33. I want you to tell us the status of this infraction before I continue with the next question.
Thank you, Mr. Chairman. Currently, we comply with the recommendations by the Auditor General. Now, it happened that some of these things happened before we came in. And so under the circumstances, it will be difficult for us to go to back. But what we are able to do is to ensure that these infractions are not repeated or reoccur.
Auditors, please, can you confirm whether they have desisted from making payments beyond 15% of the threshold?
Honorable Chair, subsequently, they are following the guidelines. Thank you.
Thank you, Chairman. I'm done. They are now following the. That's all right. Once auditors have confirmed, they are now following the guidelines.
They are now.
Yes, they are complying with the guidelines.
There is one item on the table on page 31, and I want the confirmation. That is remodeling and equipping of lease facility as treatment and holding center at Ho Voter Region. Is that the Adaklo one? And the contractor or the supplier is ADB Ghana Limited. The contract sum is $14.82 million. Is that the case?
Chair, we want to confirm that and revert. Thank you, sir.
Yes. Still waiting.
Yeah, Mr. Chair.
Yes.
Yeah, so the cost of the original cost of the remodeling. Come again. No, it's in cities. Yeah. No,
Which one? The 14.8 million?
yes, it's in cities. It's not dollars.
Auditors, the ministry is disputing the amount you quoted, that the amount should be in cities but not in dollars. Can you confirm whether the 14.8 million on page 31 in the table for remodeling and equipping of lease facility as treatment and holding center at Ho, is it in dollars or is in cities?
Mr. Chairman, the contract value is in cedis, but the lease was in dollars. Yeah.
The lease is in dollars? Is that what you're saying?
The lease, the short term was $2.5 million. Then the second one is $2.9 million. But the contract for remodeling is in cedis.
So what do you say about the figure you quoted on page 31?
Mr. Chairman, I think we have clarified.
What did you clarify?
The lease is in dollars.
I'm not talking about the lease now. I am not talking about the cost of remodeling and equipping of the lease facility. You quoted $14.82 million in the table on page 31. I want you to confirm if it's dollars or cedis.
Mr. Chairman, it should be cedis.
It is cedis or it should be cedis.
It's cedis. It's cedis.
Why have you quoted dollars in the report?
Maybe it was a typo error.
Everything here is in dollars. So should we throw all this report away? All right, so The auditors are saying that the figure is not in dollars, but it's in cities. So how come the figure is now 20 million? This one, the ministry should respond. If the contract sum is 14.82 million Ghana cedis, now on page 28, in the table there, the cost of remodeling is 20.3 million. How come additional 6+ million?
Mr. Chair, just like I think I just indicated that, apart from the original scope, there was some additional work that was done to enhance it for it to be used as a complete hospital. And it's that component of the additional work that is causing that much, the difference.
No, the whole remodeling, the contract you have awarded to
Yes.
ADB,
Yeah.
it's 14.82 million.
Yes, so what I'm saying is that was the contract, the original contract was that, but there was some additional works.
Okay.
So there is additional work that is contributing to the difference of.
To make it the 20.3.
Yes, please.
All right. All right, Nana says that now you are doing the right thing, so let's move forward. Let's now go to paragraph 115. No. Should be 107. Let's go to 107. We have issue on the frontline workers life insurance package. According to the auditors, the ministry paid 10.3 million Ghana cedis as premium for special life insurance cover for 10,000 health workers and allied health professionals who were working on the COVID pandemic without any life insurance policy documents. And the insurance companies involved are there: Enterprise Life Assurance Company Limited, SRC Life Company, Glyco Life, Star Life, Hollard Life Assurance, Ghana Union Assurance. Is it my or me? MI, my Life Assurance, GN Life Assurance, Alliance Life Ghana Limited, and Ghana Life Insurance. The chief director explained that issuing health workers and insuring health workers under the pandemic was novel to the ministry and even the insurance industry in Ghana. Hence, they did not know which health workers to list and the ones to leave out. They therefore paid the premium for a blanket coverage of 10,000 health workers. The recommendation of the auditors that the chief director should liaise with the Ghana Health Service to identify the health workers and the allied health professionals, to educate and assist the workers to complete the necessary insurance document to enable them apply for the benefit. Have you complied with this recommendation?
Yes, Chair, we have done that. We have liaised with Ghana Health Service, and the affected staff are under the insurance cover and have received their claims.
Are they still under the insurance cover?
No, it's expired.
It has expired.
Yes, sir.
So, Has any staff benefited?
It's a total, I think it's more than, it's not up to the 10,000, but more than 6,961 put in claims then to be covered, to be paid. And our information, our checks show that they have all been settled.
Okay. Auditors, can you confirm this?
Honorable Chair, a total of 5.2 million claims has been paid to 420 health workers as of 31st December 2022.
So this figure is far, far less than the 6,000 you have mentioned. All right. There's nothing to do about that. They are no more renewing the insurance. So. Honorable Afifa.
Chairman, thank you. I want to find out, they registered the workers with 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So out of the 10 companies, the 6,961, which of the companies did they apply to? And then, I don't know why, Chief Director, how can you, even though there was a pandemic, there was a serious thing, everybody appreciate that, but let's assume that we are here, you want to insure us, and you don't give us the certificate, you don't indicate. How do I know that in case there is, I have a problem, how do I claim it? And on what documentation did they base this 6,961 base? What documentation did they use to claim from the insurance company? Thank you.
Thank you very much, Chair. Indeed, like we mentioned before, it is a novelty. The consortium of insurers came together to form one group that were doing the insurance. So certainly, we connected them to the consortium, and that is where they applied for the claims. But it will be difficult to tell who got which from which particular insurance, because they were in a consortium. Thank you, Chair.
Yes, Honorable Afifa.
Chairman, thank you. Let us assume that you registered 10,000 health workers. Let us assume that 11,000 people applied, were affected, and they applied. Who is going to benefit and who will not be benefit from this insurance package?
Clearly, we didn't have that case, and I'm happy it's a hypothetical case. We insured 10,000. We have about 19,000 frontline workers, but we insured 10,000, hoping and praying that not all of them would necessarily be affected by that. And we were sure that we did not exceed the number. Thank you, Chair.
Chairman, thank you. I yield to you.
All right, let's move to paragraph 115. Single source procurement without PPA approval. 9.2 million Ghana cedis. It's saying that the ministry entered into 4 contracts for a supply of PPE at a cost of 9.2 million through a single source procurement without approval of the board of the Public Procurement Authority. The procurement, as a result, was executed without the scrutiny and transparency expected under the contract. Hence, the ministry may not receive value for money. And auditors, you are recommending for retroactive approval, which I disagree. This is similar to earlier one that we saw. It's a complete violation. Because if you read the Public Procurement Act, I think section 40A, it is clear the procedures that you can follow to procure through a single source. So if you fail to seek approval from the authority, that is a Public Procurement Authority, there's no way that you can go back because they cannot give you a retroactive approval rather than to rectify it. So we are going to add this one. Clerk, take notes. We're adding this one to the earlier one. We made a recommendation. Paragraph 121, ranking.
Honorable Chairman.
Yeah.
Yes.
We want to kindly draw your attention to this particular case for the fact that PPA has granted the approval, but even though it may not be right or consistent with the law, as you have indicated, we want to appeal to you to consider our plea that
So the PPA is also doing the wrong thing because they know very well that they cannot give retroactive approval.
Honorable Chair, well, I don't know. Maybe PP and the minister are on the same page so far as the interpretation of that clause is concerned.
They don't have power to interpret.
Our understanding of it.
It is a court that has power to interpret. So we'll refer you to the court. Let the court interpret and set you free. It's better that way.
We want you to set us free.
No, I don't have that power. I don't have it. Unfortunately.
Okay.
Yeah, okay. Chairman, ambulances not delivered. The ministry entered into a contract for the supply of 26 Toyota Hiace Deluxe ambulance, valued at $4.0 million, out of which 607,000 was paid. They were supposed to deliver the ambulance by the end of September. As at September. September, you have not supplied. We're supposed to deliver by 15th of January. As at September, they have not. And have the ambulances been delivered now?
Mr. Chairman, yes, sir. Now, out of the 26, 24 have been delivered.
What about the two?
The two is due in Ghana by 11th August.
11th of August.
Yes, please.
So when were the 24? When were they delivered?
Pardon me?
The 24 that have been delivered. When were they delivered?
About 2 months ago.
Yeah. We're supposed to have been delivered. Okay, you said there was an extension.
Yeah, we
granted
extended
to
the
them
contract
up
up
to
to
March.
the end of August.
No, the record says you did the extension up to the end of March 2023.
Yes, that was the first extension. So when they delivered, and we realized that there was 2 outstanding, we then extended it to August.
Are you sure about that?
30th. Yes, sir. I'm sure about
Can you
that.
provide documentation for the extension?
Yes, sir, but not now. We can provide it.
Auditors, can you confirm anyway whether 24 has been delivered?
Honorable Chair, we can confirm that 24 out of the 22 has been delivered. 24 out of the 26 ambulances has since been delivered, leaving 2 outstanding.
Okay, Chairman, I yield to you.
But the extension of the contract is up to March 2023. So the default again, no, they extended it to March 2023.
No, they said they have extended it to August 2024. And I asked, please, can you provide that extension document to the auditors?
Mr. Chairman, we can provide those
Thank
documents
you.
later.
Honorable Isaac.
Chairman, thank you. I want to find out whether they were supplied at the same price. Yes.
Mr. Chair, yes, it was supplied without any variation.
Thank you.
Honorable Yusuf.
So I want to find out whether the Ambulance Service Directorate was involved in this process and that they have satisfied that these ambulances that have been delivered meet standards. Can you confirm that to us?
Confirm, even after delivery, we did a letter to them to confirm whether they have been supplied in the right quantities and in the right specification, and we have a letter to that effect.
So if you wouldn't be bothered, if you can give us a copy of the letter so that we know that indeed those ambulances met specifications and that they have certified that.
Okay.
Thank you.
Honorable Kofi.
Thank you very much, Chairman. Chairman, I want to find out from
Mr. Chairman,
the ministry.
such letters were given to the auditors. The National Ambulance confirmation of the receipt of the vehicles, the delivery.
He wasn't actually talking about receipt of the vehicles. He says whether they participated and confirmed that the vehicles are up to standard for their use, not receipt of the ambulances. But let me just ask mine.
Because you have raised it, I think I should clarify here. I said, were they part of the process, okay, of the procurement, and have they certified that what they have been involved in doing and what they have received have met the items have met the specifications? Because there are instances where the Ambulance Service Directorate will be there, nobody involves them. You go and procure your ambulances and you come and tell them that come and satisfy. We want to find out whether indeed from day one they were part of the process. That's the confirmation I wanted.
Honorable Chair, they were part of it. And indeed, when they delivered the vehicles, we wrote to them to confirm the right quantities and the right specifications, and they did.
So now I want to take you to paragraph 124, that you indicated to the auditors that upon technical inspection by the World Bank, additional specifications have been recommended. Was it the case that, but for the World Bank involvement, you were satisfied with the previous technical inspection that you did?
I will use my position to the Director of Procurement to answer this question.
Honorable, please, can you come with your question again, please?
I'm saying paragraph 124 says you told the auditors that it was upon the World Bank technical inspection that led to a recommendation for some specifications being added. And I'm asking whether, until this World Bank team's involvement, you were satisfied with the previous specification, and without which the extension would not have been needed.
It is actually the ministry's technical that made that recommendation. It wasn't the World Bank. That, and my technical colleague is here. Initially, the ambulance were supposed to come with X-ray fitted in it. That was the initial, because of the exigency at that time with the COVID. So that before we take a patient from the house to the hospital, they will be able to check. But upon technical advice, we realized that it is dangerous to have the X-ray fitted in the vehicle. That's why we separated it. So it was the recommendations by the Ministry Technical, not the World Bank, Honorable.
So the first advice of placing X-ray devices in the ambulance, who made that one? Was it with the ambulance people, as you indicated, that we should put X-ray devices in the vehicle, the ambulances?
This is a very difficult question for me, to the extent that I wasn't there. And those who were there too are saying they were not part of it. And so it's difficult to get the right information seriously to somebody. Yes, and it's a very difficult situation. I'm able to speak to the delivery of the vehicles because currently I am there. And that's why I'm able to speak to it that, yes, we have received the 24 in the right quantities and the right specification. That one, I will not run away from it. These are the facts. But who did the specification and then who did the recommendation, nobody wants to give you the answer. It's unfortunate.
Anyway, we thank you for being forthright with us on this issue. But my only worry is, if the previous recommendation was to add a device, and now it came out that the device be taken out, it should not have resulted in extension of the contract. It should rather have shortened the supply period, because you are not really going to, you were taking out the X-rays, which was part. Or was there any other thing that was added that wasn't in?
Yeah. Honorable Chair.
Have you been sworn in?
Yes.
Okay. Kindly introduce yourself.
I'm Dr. Nicholas Ajabu, Head of Biomedical Engineering Unit. The ambulances initially was for transporting the COVID patients. I think around 2022, when COVID has subsided, the documentation was forwarded to my office to review and advise. Upon review, we realized that the X-ray as a radiation emitting device could not be used as was intended. Though the X-ray was to help quicken the detection of the COVID and the seriousness of the patient condition before they arrive at the center. We realize with the COVID subsiding, we'll use it as a normal ambulance to transport patients, not only the COVID. And if we were to use it as earlier intended and establish the transmission of data in the COVID center, is going to be a cost and will further delay the delivery of the ambulances and its use. So we recommended that we take the X-ray out and use it as a normal X-ray in our hospitals and use the ambulance as a normal X-ray for transportation of emergency cases. And that's how come we got to this level. Thank you.
So it means now you have 26 standalone X-rays.
Yes.
And the ambulances.
Yes.
Okay. But it did not affect the cost in any way, as answered earlier, that the cost remains same.
Yeah, it did not affect the cost of the main items. Because we are going to install them and use them in hospitals, the places where we will install, if they require further improvement in the room where the X-ray will be installed, then we need to do some modification to meet the radiation protection standards. Thank you.
You said ambulances were supplied just about, I think, 2 months ago. So what about the X-rays too? Have you installed them? Or if you haven't, may I, Dr. Kumar Buaji, may I appeal that you bring one to my district hospital? Thank you.
Yeah. Honorable Chair, okay.
Yes, go ahead.
Yeah, approved. As soon as I receive them, I'll give you one.
You have, Director General, you have already received them because 24 are available, isn't it?
Yeah, so...
So you have received them already?
yes.
I believe the medical engineering session or whoever received them is you who have received them.
Yeah, they will receive and then hand them over to the users. So we have them.
So where are the machines now? The X-ray machines, where are they now?
They are yet to be distributed.
Yeah, what?
Yet to be distributed, as far as I know.
But where are they located now?
She mean at the temporary central
Medical stores, okay. The head of biomedical engineering, when you were speaking earlier on, you said the contract was referred to your office, my office. Then, upon review, we realized that, I'm quoting you, you and who?
His office.
Yeah, because I work with other biomedical engineers, I was referring to the team. And we advise our superiors accordingly.
All right. Honorable Isaac.
Chairman, my concern has been addressed.
All right, so Honorable Mutala.
Chairman, I want to find out if the X-ray machines could not be fitted into the vehicles. What factors went into the purchases of them? Because clearly it means that they didn't meet specification. Because one would assume that before such are going to be done, you would have taken into consideration specification, which is very important in this case. So if you didn't meet specification, why did you go ahead to purchase such?
Well, I will not allow that question.
But you know, W from you know what he said.
Paragraph 126, Vice Chairman.
Thank you very much, Mr. Chairman. Now, Chief Director, medical equipment valued at $247,404 US was procured and received at the temporary Central Medical Stores and subsequently issued to some specific health facilities between January 2021 and June 2022. Then, as of November 2022, these items had not been delivered. Some of the items had been received for a year and a half. Then the director of the Central Medical Stores explained that though the items were issued to specific facilities, officers of regional medical stores and nearby facilities were made to sign for the items with the responsibility of delivering the items to the specified facilities on behalf of the Central Medical Stores. The director admitted that sometimes the officers do not deliver the items on time, hence they are remaining unaccounted for. So a year and a half, they received the item. They couldn't deliver it. Was it going on a horseback or what?
I would request my director of procurement, who is directly in charge of the Central Medical Stores, to respond.
Mr. Chair, thank you very much. Normal, from when we are distributing things to the facilities, per our procedures from the central level, you have to go through the regional, then from the regional, they also deliver to the facilities. Now, during the COVID, what happened is that if a facility A is supposed to receive a certain item, they enter it in records at the facility that facility A is supposed to receive this. But in delivering, they send it to the region. Then the region will take it to that facility. So that is, when they get to the facility, the region, that's where the delays happen. Honorable.
I'm disappointed in this answer because this was in the middle of COVID and they needed these equipment and they delayed these equipment at the regional centers. You were so much in a hurry that you paid millions of cedis and dollars to renovate a building so that we get people right in there. You made purchases without going through proper procurement processes because we are in the excuse was we are in the middle of COVID. And here we are in the middle of COVID, you receive an item and a year and a half, almost 2 years, in the middle of COVID, we haven't delivered these. Have we delivered them now?
No, we had been delivered. And then
isn't that sad?
they have been delivered.
In the middle of COVID and then for almost 2 years, you don't deliver the equipment. That means we didn't need the equipment after all. Because people would have died because the equipment was being kept at the regional offices. I think it's about time we start suing people who, through their negligence, when people die in hospitals because we are negligent, a year and a half. Even if we're carrying the thing on your head from here to Tamale, it would have been there before 2 years. Auditors, could you confirm if these items have been delivered?
Honorable Chair, after the report, all the items have been distributed. Thank you.
Thank you very much, sir.
All right, so let's move to paragraph 130. It's on utilization of unutilized medical equipment and accessories. So auditors observed that during their field visits, 8 health facilities that medical equipment valued at $367,699.68 delivered to the facilities to aid in the combat of COVID have been packed and not put to use. The details have been provided in Appendix C. Appendix C, let me see where the Appendix C is. Okay. Page 91? Okay. Yeah. Unutilized medical equipment. They are here in their numbers with the facilities all stated here. Yes. So the heads of the facility gave various reasons, including the need for training before using the equipment, instruction to wait for the supplier to install the equipment is one of the reasons. They need to have space to set up the equipment, among others. Now, if the equipment is not installed early for use, benefit from the warranty period could be lost. That's according to the auditors. They could become malfunctional, and additional funds will be needed to service them before they are put to use. The auditors have recommended to the Chief Director to ensure that the equipment are installed and put to use without further delay. What is the status of this recommendation?
Mr. Chairman, they have been installed.
All the equipment have been installed?
Yes, Mr. Chairman.
And they are being used now?
Yes, Mr. Chairman.
All right. Auditors, can you confirm this for us?
Honorable Chair, we can confirm that. Thank you.
Okay. Then, paragraph 135, faulty or damaged medical equipment. Now, the auditors noted during their visit to 9 health facilities in the Greater Accra, Oti, Eastern, and Western North regions that medical equipment procured at a cost of $451,979.38 to assist in the fight against COVID-19 had broken down. And we have the table there, mobile X-ray, hematology analyzer, suction machine, fetal heart detector and stands, COVID refrigerator, and a number of items. Now, the heads of the facilities involved could not provide any reason for this anomaly. The auditors have recommended to the Chief Director to ensure that non-functional equipment is repaired and put to use. What is the status of this recommendation?
Yeah, they've all been repaired.
Kindly use the mic. You are recording.
They've all been repaired.
All been repaired? Yeah. Are they being used now?
Yes.
Auditors, can you confirm?
Honorable Chair, confirmed.
Okay. Paragraph 140, Honorable Isaac.
Thank you, Chairman. Chairman, 140, medical equipment delivered to private facility. Chairman, the auditors noted that medical equipment, quite a number of them, 21 separate equipments, valued at in different quantities, valued at 110 and 88, 110,088 United States dollars and 27,895 Ghana cedis. These items were issued to a private hospital, and the name of the hospital is Christ Leeds and Specialist Hospital. And this hospital belongs to one Dr. C.K. Amenu Veve. Surprisingly, this facility did not serve as a COVID isolation center, neither was any COVID patient referred there. Yet all these equipments, 21 of them as I've indicated, were given to them. So the recommendation is that the Chief Director should investigate the issue and submit a report as soon as possible. And also the doctor should pay for the cost of the equipment at the current market value. And if he fails, the amount should be recovered from the Chief Director.
Thank you very much. Okay, so yes, it is true. The equipment went to a private facility, but approval was given before it was sent to the private facility, because then he was strategically located to be receiving COVID patients. It is also on record that he received COVID patients, so there's evidence to show, and we have sent it to the auditors appropriately. However, after our investigations, we realized that, yes, the equipment are with him, but he cannot pay for the equipment. And wherever he is right now at the Medina area, he's also serving a sizable population also. So we are taking steps to retrieve, even though he's also serving the need there. He has adequately told us that he actually cannot pay for the equipment, so he's ready to give them up if we wish. Thank you, Chair.
Number one, who granted the approval? And number two, was there any agreements between is it the ministry and the hospital?
Thank you very much, Chair. The owner of the facility officially applied to the ministry then, and approval was granted by the ministry. So the auditors have a copy of the request and also the approval. Thank you.
Chairman, I think also requested to...
The question was in two parts. The approval and then the agreement.
There was no such agreement. However, the agreement before the approval was granted was to treat COVID patients. In the heat of the COVID pandemic, he was strategically positioned to receive and also to take care of patients. So that was, in principle, the agreement. The reason why he was granted those equipment. Thank you, Chair.
If you say approval was granted, does it mean Dr. C.K. Amenu Veve requested for the equipment?
Yes, Chair.
He did?
He did.
Can you make a copy of that
yes, sir.
Request available to
yes, sir.
the committee?
Yes, we can.
And how many patients, COVID patients, were referred there?
Currently, we may not have, but then there was evidence that he received some patients. It will be difficult to know.
No, but because the auditors have reported that no COVID patients was referred
No.
there. And you have told us
Yes.
that, yes, you have investigated and found out
Okay,
that
so-
patients were referred there. And
Okay,
we
I
are,
understand the question now.
yes.
But I'm saying that he has brought a dossier to show the patients and their records, but I haven't counted, and we haven't counted how many. But there's evidence that COVID patients were there.
And the doctor is saying that he cannot pay for the equipment. Is that the case?
Yes, when we did the investigations and we contacted him, that was the information we
No,
got.
but you are saying that there was some agreement or arrangement.
Yes.
So in that arrangement, what was indicated in the event that he is unable to pay for? I mean, did you indicate that he will pay for the cost of the items in the agreement?
Initially, the premise was if he did not receive any COVID patient, then he must pay for the equipment. But there's evidence that he received COVID patients. So we needed to get by to apply this latter part that said, yes, you received COVID patients, you use the equipment, but now that you are not having COVID patients again, must you or must you not return it? That is the question now. Then it didn't arise because the matter was, the auditors reported that they didn't find any evidence that he received COVID patients, therefore he should pay for them. But he proved through the investigation that he had received, and we have submitted the evidence accordingly.
Did you indicate in the agreements? I mean, some of the items are consumables, some are not. Did you indicate
There was no agreement.
did you indicate in the arrangement that the equipment was going to go back to the ministry after some time?
No, that did not arise, Chair.
Yes, it was a gift.
No,
of a
no,
sort.
Chair, it was not a gift. Then, because of the COVID patients, he was given that equipment to be able to go around the matter. And he has installed some of them. He used the equipment. He used some consumables. Now that it is over, that is now that we have to determine. But the audit response recommendation was, once they didn't find evidence that he received COVID patients, he ought to return them. But now there's evidence that he has received COVID patients. So must we or must we not let him return the equipment?
Did the doctor submit any report to you?
Yes, yes, Chair.
He submits a report to you.
He submitted evidence that he has received COVID patients.
No, not the submission alone. I mean, report about patients and all that, because, you know, the equipment's very expensive. So I expect that at the end of the day, some report will be submitted to you to indicate, you know, that the equipment were not supplied for nothing.
Certainly, yes.
So
He
can
showed
you make-
evidence. He showed evidence of the COVID patients he had actually seen and all that. But subsequently, he's not reporting to us because we are not talking COVID now. He still is at the facility using any such equipment for other patients.
I want to find out, Honorable Minister, Deputy Minister, is the Ministry of Health, and for that matter, Ghana Health Service, is telling this committee, per the answer being given, that apart from the ministry's facilities or Ghana Health Service facility that received COVID patients and treated them, you don't have information on all the private hospitals or facilities that also receive COVID patients and treated them? Is that what you're telling the committee?
Thank you, Chair. This is the only private one we have information on. This is the only known one that he applied for and received.
So you don't know if any other private hospital received COVID patients and treated them. You don't know.
They may have, but they may not
The
have
question is that
received.
you don't know or you know.
Chair, please pose the question again.
My question is that apart from your own facilities,
Yes.
Ministry of Health, Ghana Health Service, that received COVID patients and treated them, do you have information on any other private hospital or facility that also received COVID patients and treated them?
Yes, obviously we should have, Chair.
That shouldn't be the answer to my question. Yes, we have. Yes, we know.
Yes, we have.
And
Yes,
how many of these private hospitals that received COVID patients and treated them?
Chair, that would be difficult to determine now. But we know very well we were together with the private sector receiving and treating COVID patients. With this particular instance, he was the only private facility as at now, that received equipment and, yes, equipment from us to treat COVID.
That even make it more important for you to have interest in that facility. That, oh, you are the only facility that we supported. We want to know how many patients you have received and treated. You didn't do that. Until the facility came themselves and providing information to you that, oh, this is the number we have received and treated. Why? Yes.
I want to find out from her then, how were the other private facilities treating the COVID patients without equipment? Were they also, so they were not supported, so how were they treating them? And what's the state of the equipment as we are speaking now? Have you gone there to have an inventory, the state of the equipment and all that? And I'm surprised that the doctor had the guts to say that he's not returning the equipment. You have to ensure that we streamline some of these things, ensure that the equipment are probably returned to public hospitals, because other facilities, other private facilities also participated and supported Ghana Health Service and Ministry of Health without these equipment. So how did they treat the patients?
Let's get a response to that question. I will come back to the owner of the question, Isaac.
Yeah. Honorable Chair, just to throw a bit of light on what my director has already indicated. You know, Dr. Menuveve is a retired surgeon. He does endoscopy and also provide surgical services. Before COVID, those who could not pay, he was offering those services. So during the COVID, he volunteered to support Ministry of Health. And hospitals that had cases that were positive for COVID, he offered to use his endoscopy suite to help diagnose them. Otherwise, those patients couldn't receive any procedure. And so, as we were trying to set up special operating theaters and things for COVID patients, he approached the Minister for Health and requested that if we could support him with equipment to help him set up so that COVID patients who need such surgical procedures could be referred there for him to handle. And so that was the role he played. And that's why the ministry gave approval and provided those equipment. Now the COVID has subsided. So we are in a different era now, and situation may be different.
Doc,
Thank you.
Your explanation would have helped. You have explained the process. The reason why is the only person who was supported. How many patients has the ministry referred to the facility?
I think he was receiving patients from 37. We need to get into those, but he provided some information. We try to go into his system to see which cases he was able to manage, those who needed surgical intervention that he was able to manage. But unfortunately, he's lost some data because he had problem with his computer systems that he was using. But we were able to retrieve some information which director was referring to. Thank you.
But is it not surprising that as managers of health services in this country, you don't have this information? How are you managing the health sector? You are the managers of the health sector. You should have all the information about this. Isaac, do you still have questions?
And just one last one. I just want to find out when these equipments were being sent, were they accompanied with a letter? Or waybill? No, letter. I mean, I just want to know the contents of, yes.
Okay, Chair, before I answer that question, I'd want to correct an erroneous impression that we don't have data on them. We have data on all facilities we work closely with, so we do. Indeed, we do have data on them and on this particular one also. But to your second question, because the process was that which he applied and also the ministry approved, we went through the processes, we billed everything and delivered accordingly to him.
Honorable Yusuf.
Chairman, thank you. Madam, I want to find out why, in your opinion, such a transaction would take place without any written agreement. Why do you think you should do this without any written agreement? Assuming you were not at office today, who will be responding to this issue?
Chair, I think that we felt the documentation we have is the fact that he applied and we also approved and have so given the equipments to him to deliver health service.
From your
That
answer,
alone-
from your answer, it means that what you have given him is a gift. Do you agree?
It will be difficult to say it's a gift because
It will not be difficult
Then-
at all, given the answer you are giving us. It's not a difficult thing. You have given him a gift. He applied to you that he is in need of A, B, C, D. And because you thought he had helped you at a point, you also decided to help him by giving him those items. If that is the case, let's know.
those items then were required. If it's now that we are not talking about that, then we can take the argument.
You never
forward.
told the man
But
that you were
then-
giving him the items for a period and then you come for it. If you have done that, where's the evidence?
In fact, we didn't actually know who come for it because we didn't know that.
Exactly my point. Exactly my point. So you gave him a gift. It's only because auditors are saying that you shouldn't have done that. Now you are going to retrieve them.
Sir,
So
why, why I will not call it a gift was then it was important. Then. And he has actually used them to.
My last point. My last point. Do you agree that this transaction, there's some amount of negligence in this transaction from the Ministry of Health? Do you agree?
No, Chair.
You don't agree?
No.
I want to put it to you that if you were a part of it, then you were negligent of your job. And you should be punished for that. To the extent that I can even read meanings of corruption into your behavior. No, let's face it. You can't take state money and manage it the way you've managed it and come and sit here and be defending it. If I were in the shoes of the man, I won't pay a penny. I wrote to you requesting for support and you gave it to me. Okay? The person who approved it and never thought of going into a contractual agreement with that man should be held responsible. And you are part of it.
But Chair, he's ready to bring the items back, like I said.
But I thought you said the doctor says you won't return. So I was going to ask.
No, Chair, I didn't say that. I just said he's not in a position to pay for them. But if the ministry so wishes and we want to collect them, he's ready to return them.
So do you wish to collect them back?
Yes, in this circumstance, yes.
I don't know that's a result of your negligence.
Honorable Mutala.
Thank you, Mr. Chairman. Director, was the center a certified center for the purposes of COVID? Was it a certified center?
Right now, I can't tell, but I can find out.
No, Director, don't be giving us these answers. You are the director in charge, for God's sake. You should have known all the centers that were certified. In fact, Chairman asked you, Chairman even asked, on this, tell us how many of the private centers that you engage in. You could mention only this center. You should be able to tell us whether it was a certified center for the purposes of COVID or not. That is one. Two, Mr. Chairman, if you read the recommendations, paragraph 144, the auditors recommended that the chief director should immediately investigate the allocation to Christ Leeds and Special Hospital and report accordingly. That we also recommended that Dr. C.K. Amenuvu should be... Amenuveve. I need to increase my eating of apple. Should be made to pay for the equipment at the current cost, failing which the amount should be recovered from the chief director. Chief Director, have you been able to carry through the recommendation of the auditors?
Honorable Chair, we have not been able to do that, but let me assure you that we will do it.
It means that it was not done. Mr. Chairman, my last point. The reason why Chairman was asking the question as to whether indeed you should know the number of patients who were referred to that entity, it did not include only machinery, it also includes consumables. And those consumables were provided by the state for a purpose. So if you are providing consumables for a purpose, you should be able to know how many patients those were used for treatment. You should be able to tell us that. So if you sit here as a director, and then you can't tell us how many patients went through there, then God save this country.
We can find out, actually.
Director, you see, the recommendation was for the chief director to immediately investigate the allocation to this hospital and report accordingly. Now, if you haven't done that, and you come and sit here and give us these stories, what does that mean?
Chair, like I said, we actually investigated, and the investigations went like this. He applied for, the ministry approved, we gave him the equipment, he treated COVID patients, but the recommendation there was he did not treat COVID patients. If he did not treat COVID patients, then he ought to return the equipment. So in our investigations, we found out that he treated COVID patients, even including what Dr. Ajebu mentioned, doing endoscopy and those things. He did. So that fact was established. So it is up to us right now. And in the investigations, we found out that he ought to pay for the equipment well after COVID has passed, because the main purpose for which it was granted is over. Is he able to pay or not? Then he said he is not in a position to pay. We could come for the equipment if we wish. That is where we are right now. And
Madam,
that is what we haven't been able to do.
Do you have a copy of the report to give to this committee?
We can provide it, sir.
And if it was a certified COVID center and he treated COVID patients, how come when the auditors went there was nothing to show that it was a certified COVID center, and they are telling us that he didn't treat any COVID patient? But you found out that he treated COVID patients after the fact.
Exactly, because we have the records. The records are there. So it was also very strange.
How come the auditors? How come the auditors didn't get that record?
Chair, I don't know. But the records are there. We can show it. Yes.
Honorable members, let me find out from the auditors. I know as part of your work, you do verification and you ask for documents as part of your working papers. When you are you are doing the audit, did you visit this facility and did you demand from the owner evidence to the patient that he treated? Any information provided to you?
Mr. Chairman, we did. And we never got any evidence that he treated COVID patients. We went to Pentecost, PCC, Pram Pram. We went to so many places, including that one. And Pram Pram, there was evidence COVID patients were there. Pentecost, there was evidence, and other places. But in that place, we never got any evidence that COVID patients were there.
Did you meet the doctor in charge himself? Did you meet him at the facility?
Yes, we met him. And we didn't record, but even in the conversation, he himself admitted he never treated COVID patients.
So you are here telling us he treated, madam.
Chief Director, it is now the auditor's word against your words. The auditors met the doctor himself. He told them that he never treated any COVID patient. You are telling this committee that you did your investigation and there's evidence that he treated patient, yet you yourself, you are not even able to provide any evidence here. Even the number of patients he treated, you cannot even give it to us. So do you want us to believe you or the auditors? Chief Director.
Honorable Chair, I don't have a yes and no question, but
you have to give answer, so not question. So you don't have yes or no answer or question.
No, whether to believe us or to believe them. But I want to make a suggestion that I think we should have an independent opinion on this. Because if the auditors are saying they have not seen evidence, and then our side is saying, yes, there's evidence to point to the fact that he treated COVID-19 patients. So I want to suggest that if there could be an independent investigation to establish this. Thank you.
Thank you, Chairman. I have a problem. Maybe you'll be able to clear it for me. You were giving us statistics nationally. So those statistics that you were giving us, they did include statistics from this particular facility.
Honorable Chairman, the Director General has not spoken, so I would want you to finish.
Thank you, Chair. Yes, we have data and we record daily data. As Director General, there are collations all over the country from district to region, and I do the collation and then I make the report. I may not specifically say this patient is coming from here, but if you want to look, we can find out where each item, each case came from. That one is there because we have the analysis over the years, so we can look at that. But I cannot say there was a case that came from Medina, came from this facility, because I'll get an aggregate data to work on.
Apak.
Chairman, this is a conundrum. A conundrum. The auditors, as part of their work, and we know this to be the case, usually do field visits, inspections, and sometimes they speak to those who are supposed to either be beneficiaries or users of state assets and property. They are telling us that they spoke to the one in charge of the facility, who has told them that no COVID patient was treated in the facility. And we are being told by the ministry that after the auditors had done their work, they went and they have data to confirm that the facility treated patients. Chairman, these two positions are so diametrically opposed that one of the two responses cannot be correct. So we ought to find where the truth lies. As the Americans will say, it's now becoming he said, she said. But by default, I would agree with the auditors. Therefore, something is amiss, and we cannot accept these explanations anymore, given what the auditors have said.
All right. I'll take the last from Honorable Johnson.
Thank you, Chairman. Chairman, per the submission by the auditors, I remember I heard they also went to Pentecost Hospital, which is also a private hospital, and some other hospital that they mentioned. I want to find out that those hospitals that they also visited to do auditing, were they given similar equipment or support? That's why they went there to do auditing.
Mr. Chairman, it is Pentecost Convention Center. Yeah.
Okay.
Now, you're saying that the doctor is now saying that if we want him to return the items, he can return them. One of the items is ECG paper. Is he going to return those ones too? Is he going to return the ECG paper too?
Chair, I think so. We'd have to find out from him.
It's not consumable.
Chair, I didn't hear you.
It's not consumable.
It's possible. I really don't know what it is, but the machines are
But we
there.
have doctors here, help us.
Yeah, it's a consumable that is used when you are doing the ECG recording, just to check whether the heart is working well or not.
Once you use it, you throw it away or it's reusable.
It's a patient record.
Patient record.
So you keep it in the patient folder, but you cannot use it
For any other patient.
Any other patient.
So if he claimed that patients have visited the place and he said we should come for the items, how can he get this one back to us?
Well, we can discuss with him either he buy and replace those ones, or yeah, it's consumable.
We'll
Mr.
make a
Chairman.
recommendation. Yes.
Before your recommendation, I was going to suggest that you give us some time for the ministry to take up this matter, and then we report back to the committee so we can move on.
What time again do you need? Because this thing was the report was issued in December 2022. It's more than 1.5 years. We have also, because we are clearing other reports, it's now that we are taking this one. You see one more time?
Chairman, we have taken into consideration contributions from members, honorable members, and we think that it will inform us very well in our next fact-finding, so we'll get back to the committee, respectfully.
All right, let's move to paragraph 145, Honorable Apak.
Grateful, Mr. Speaker. Failure to issue COVID-19 equipment to the user facility. According to the auditors, the equipment is valued at 11,963 Ghana cedis. Dollars. 11,963 dollars. According to the auditors, they noted that the equipment had been issued by the Central Medical Stores to the Adabokrum Health Center in the Western North region. However, the equipment had been kept at the District Health Directorate at the time of their inspection, and they provide the details. What is the current state of the equipment in question?
Honorable Chair, the equipment in question was at the District Health Directorate. It's been given to the hospital now, so they are using it.
Well, given the kinds of heavy lifting that we are undertaking, I think I'll let this pass. Thank you, Mr. Chairman.
Paragraph 150, Honorable Akwesi.
Chairman, thank you very much. This has to do with some equipped isolation centers that were not in use. The project engineers explained that civil works and the refurbishment of these isolation centers, i.e. Dodua in the Greater Accra region, Kolebu. Kolebu had two. It had the construction of COVID-19 isolation and treatment facility. And it also had a proposed refurbishment and equipment of the fevers unit at Kolebu. They said all of these had been refurbished, the necessary equipment had been provided, and at that time was awaiting the ministry's approval for takeover and use. So they recommend that the chief director of the ministry ensure that these facilities were put to immediate use. What is the status of these three facilities?
Mr. Chairman, we have fully operationalized these facilities. Refurbishments of these facilities have been completed, and then the remodeling of the old Dodua Hospital as treatment and holding center has also been completed. So we have operationalized all the affected facilities.
When did this operationalization take place?
I'll yield this question to the Director of Infrastructure so that he can give us the actual date.
Last year. Honorable Chair, respectfully, the refurbishment of the equipment of Fifth Unit in Kolebu has been operationalized. It was done last year, and Dodowa was also done this year. It's handed over to the hospital, the district hospital. So it's actually being managed by the hospital.
But you see, according to the auditors, they said as at the time of the audit, the project engineers explained that the civil works refurbishment and the necessary equipment have been provided, awaiting the ministry to take over and use. So it means even as at the 2022 or whenever the audit was done, it means at that time the whole place had been used. And you are telling us you only did that last year.
Yes,
last year or this year?
No, last year. What is
Last
happening is that, when we finish the project, we have to do training. And I think there were some outstanding equipment that has to be installed before the place will be operational. But because of the problem that we have with the COVID, there was some problem with the issue about equipment lead times, and that delayed the coming in of this equipment. That was what actually, occurred to the fact that we couldn't actually operationalize them at the time we were supposed to do that.
Auditors, are these facilities in use as we speak today?
Honorable Chair, the facility is being used now. Thank you.
Chairman, we can continue, Chairman.
Okay. Paragraph 156, Honorable Kofi Adams.
Thank you very much, Mr. Chairman. Mr. Chairman, I requested something earlier on the hematology machines, the type that they bought, which cost $45,000. If they could help us with the type of hematology analyzers that were purchased. Chief Director, the type of hematology analyzer that was purchased, which cost $45,000 at that time. If you can help us with it, we'll be very grateful. And, Mr. Chairman, to my substantive issues to do with delayed projects. The auditors observed that a number of projects, treatment centers, and isolation, 7 in number, that was to cost us 158 million, had not been completed 30 months after construction had commenced in April of 2020. And one such has been attached to this report as Appendix E. The recommendation was for the Chief Director to ensure that these projects are completed. And you agree to the recommendation that you will do so. What is the status of these 7 isolation centers now?
Thank you, Mr. Chair. What I'll say is, the issue about the projects, because of the COVID, ideally we're supposed to complete it within a certain time frame. What actually happened was that in the course of the plan, I think we also underestimated the completion period. Again, the procurement delays, that also came in as a result of the procurement lead times. More often than most of the equipment that were procured at that time, because of the COVID, the expected delivery times were also delayed. Besides, COVID was it was a novelty, which all of us, for that matter, those of us in the ministry were not very clear as to what has to be done with it. So even some of the designs, there were some changes in the design, because we have to have a couple of other meetings with the infectious disease specialists. And this also accounted for a lot of delays in the project, because along the line we have to make some modifications to make sure that they see the purpose for which
Director,
it is meant.
We agree that there was already a delay, 30
Yes,
months
please.
delay.
Yeah.
I've only asked what is the status now.
Okay. Right, so currently 5 of them, Pantine, Cape Coast and then Zibila are at practical completion. They've been completed. Goso is at 92%, and Asawenso is about 94%. All things being equal, we expect that by the end of this, by the middle of August, the two should also be completed. So practically, the 5 has been completed. The other 2 that is actually outstanding is Takoradi and then Sunyani. That is also being funded by Ghana government, and because of the erratic flow of financing, it's also affected the delivery process of the project.
The COVID monies are being used for many other things unrelated to this. Why should there be problem with funding?
Honorable Chair, what I'm saying is that the other ones, there are 7. We were talking about 7. 5 of them were funded under the COVID mainstream. That is the money that we had from with the World Bank. But these other 2 projects, that is Takoradi and then Sekendi, is actually being funded under the GOG component.
Since 2020, under GOG component, or since when did GOG pick them up?
No, the other 2 were actually awarded, I think, in 2022, 2021. Yes, please. Those were awarded 2021. Those under the GOG.
You mentioned Pantan. Is the Pantan Center in use now? Is it being used for anything?
The Pantan Center is finished. It's actually completed. But
Accept that. I'm asking whether it's being used now.
No, it's going to be used because it's going to be. We have to repurpose it.
Are you aware that thieves have broken in there and stolen air conditions and other things from that place, and which was shown in the news not too long ago? Are you aware of that? And that there was only one person who was manning the place as a watchman, and sometimes he gets overwhelmed. Are you aware of that?
Honorable Chair, I'm not aware of this issue. It hasn't been brought to our knowledge, sir.
So, have you been following up about your facilities that are not? Is somebody responsible for such facilities, or we just left them there like that because there's no COVID at the level that it was in 2020 and 2021?
Honorable Chair, all the projects that have not been completed and handed over, it is still under the management of the contractor. So it's a responsibility of the contractor to provide that kind of security. And as far as we are concerned, there isn't any problem of that nature.
So the Pantan has not been handed over to you yet. It's still in the hands of the contractor. Is that what you are saying?
Yes, please.
Okay. Thank you.
All right. Director Infrastructure, when you say that 2 of the projects are being funded from GOG, when we look at the total money mobilized for COVID, the 21.844, there was a component called Other GOG. Are you referring to that component, the other GOG, which is being used to fund the Takoradi and Sunyani projects?
Honorable Chair, the fact that, I mean, what I can say is that, as far as we are concerned, suppose we actually fund it through our ABFA. It's ABFA allocation that we're using to fund these 2 other projects.
Wow.
The Takoradi and the.
Do we have Minister of Finance still around? Coordinating Director, can you join the table? The Ministry of Health is saying that you are funding the project from ABFA. Is the ABFA part of the other GOG amount of 2.1? I think 2.1 we saw earlier on.
What I can gather, no, it's not part of it.
because from 2022 was mainstreamed in their budget, so it's not part of the
Yeah, kindly speak to the mic so that we can capture it well.
Sorry. I spoke into the mic. Should I repeat?
Please repeat.
Oh,
repeat
sorry.
it.
Okay, okay. I'm saying that, as far as I'm concerned, from what I gather, this became one of their mainstream projects because it was started after 2022, and so it's part of their main budget and part of their main ABFA resources, if he says so. I don't know the specifics, but what I gather, after 2022, it was mainstreamed into their budget.
Before 2022, did we use part of the money mobilized for COVID to fund this project?
No, please.
So this shouldn't have been part of this report.
I don't know why the auditors.
Yeah, according to the Minister of Finance, they did not use any of the money mobilized for COVID to fund this project. The two, the Takrady and then the Pantang. Sunyani. So they should not be part of this at all. All right. Let's move on. Paragraph 162, Honorable Yusuf.
Chairman, thank you. Chairman, the infraction is that the ministry awarded a contract to the sum of 15 million Ghana cedi to Macro Structures Limited to design, construct, and equip Nalerigo Treatment and Holding Center in the Northeast region. 30% mobilization, which amounted to 4.5, was paid to the contractor. The contractor went to site, and according to this report, after about 10% work, abandoned the site. I want to find out the state of this project, whether he's gone back to complete it, whether you've terminated it, what exactly is the update.
Yeah, thank you, Honorable Chair. I mean, just like the observation was made, I mean, this particular project was awarded, and of course, like you were saying, for now, the project has been terminated, and we are in the process of doing the re-awarding.
Were you able to retrieve the money from him, the 4.5 that you've given to him? Were you able to retrieve it?
We have been able to retrieve part of it.
How much was retrieved?
$188,000. 88,000. Yes, please.
I think we should get it right. He's done some 10% work.
Yes.
Have
so
you
that's
been
what
able
has not
to?
been valued.
Have you been able to establish how much you're now supposed to retrieve from him out of the 4.5? I don't know whether I'm making myself clear.
No, you are perfectly right. We haven't done the estimation, but I think we need to do that. The 10% that he's done, we have to do that, and then we can add it to the 188.
I think you should take us serious, small. I bet. You have given 4.5 to somebody. The person has done some work. You have been asked by an auditor since 2022, okay, to retrieve the amount of money that he hasn't utilized out of the 4.5. And you're now telling us that
No, Honorable, no. I think what I said, the information wasn't available now. And at the time of termination, the value of works was 1.114. Yes, please. 1.114. 890.
What he had done.
Well, that's what the value of what he has
So we're
done.
still level about almost 3. And out of the 3, he paid 180 million, 1,000.
180 million. Even that we have to even fall on the bonds that he submitted. In the insurance insurance company that actually provided insurance cover for the project. They also, unfortunately, went into liquidation. So that was how much we could retrieve from the contractor.
Director, you have raised another issue. The auditors are saying that the absence of performance bond contributed to the difficulty in retrieving the money. I wasn't going to mention this, but you are saying that you have a performance bond. Auditors are saying you don't have it.
No, it wasn't a performance bond. Because normally, see, the fact is that once you award a project, and you give an award notification, in the person, the prospective contractor responding to the award of the contract, he has to produce a performance bond and an advance payment mobilization if it has to go for mobilization. So there's no way we even sign the contract without a performance contract, a performance bond covering the project.
Let's go back to the auditors. Auditors, is your word against their word? Was it the case that there was no performance bond, or you didn't see it? Let's reconcile this.
Mr. Chairman, we didn't say that.
So what I can deduce is that you requested for it and it wasn't given to you. Is that not the case?
There is usually a contract file, and when we went through the file, we didn't see it.
Director, in your ears.
Honorable Chair, there was a performance bond.
So where is it? That auditors will come and stay in your outfit for all this while and you wouldn't show it to them. So at this point, I think that we'll go by the auditor's position, because if it was there, you would have given it to them. But another interesting aspect of it is that you paid mobilization of 30%. By law, don't you think that you've breached the standards? Is it supposed to be 30%? If you don't want to come with the figure, I'll tell you, it's supposed to be 15%, and you have doubled it. Any motivation for which you have to make it 30%? Director? Oh, okay.
Who is the owner of Macro Structures Limited? Who is the owner? Macro Structures Limited. Who is the owner?
So, Chairman, it will be difficult to know the owner.
How will it be difficult? You have awarded contract to somebody. Who are the directors? Who is the director who came for the contract? Who is the director who came for the contract?
Mr. Chairman, can we pen it down as one of those things that we will provide later?
Well,
we may not have that information
We'll
now.
pen it down tomorrow. You are coming tomorrow. Go and look for the owner of this and bring it tomorrow. Clark,
Yes, Mr.
flag
Chair.
this. We need to know the owner of the Macro Structure.
Chairman, let me just add that this is supposed to be located in northeast. That is Nailergu. Northeast is where the vice president is coming from. And so it's important that, no, let's face it, it's important that you don't embarrass him. Because this is a project, if he had gone there to commission, his people would have been very, very happy with him. Today, this project is at this stage. Don't you think it's an embarrassment to him? And no, I mean, see, when we are talking, you allow us to talk the facts. Oh, so you see, you are preempting me. Okay, so I won't say it here.
Honorable Ajebwati, do you know the contractor? Do you know the person? Do you know the person? You don't know, and you say you know where he's going.
We don't want. No, what I'm saying
He's
is
saying that this is a project in the region of the vice president. So the project, in fact, must be completed to the credit of the vice president. That's what he's saying. So we are looking for the contractor and asking why he should abandon the project.
No, it's important. Let me tell you.
Mr. Chairman.
Even AstroTurf, the first AstroTurfs in this country, the first 3 AstroTurf, where one was located at the president's home, the second one was located at the vice president's home, the third one was located at Boniface constituency. Very important, because when they go to commission it, it adds something to their credibility and their performance. So such an important project will not sit and allow you to embarrass the vice president.
Mr. Chairman.
Order.
Mr. Chairman, I think the honourable member is crying more than the bereaved. The reality is that these projects are for the benefit of all Ghanaians, those living in those regions. I'm not sure it would be right for us to say that these projects have gone there because of the vice president. He seems to be crying more than the bereaved.
Order. Honorable members, we don't want a project which is started in any part of this country to be abandoned. And especially if it's in the region of the vice president. We need to make sure that the contractor complete the project. So we will know the contractor and ask him why he didn't finish the project.
The chairman will promise to get you the details tomorrow.
Honorable members, we'll get the name of the contractor tomorrow, so let's move forward.
Chairman, but just
okay, Director.
Just one thing, Chairman. Chairman, just to add that we are also interested, because the contractor is not doing the work the way we expect him to do it, we are interested in knowing the procurement process that was used in selecting him. Because sometimes when that is not done well, that is where they begin to do this. So we should also establish the procurement process that was used in selecting him, so that we'll learn lessons from this going forward. Thank you.
Mr. Chairman, I have a document here that mentions Yao Ejari Dankwa as the managing director of the macro company.
Managing director, the managing director could be an employee of the company.
Well, so
it might not be the owner, it should be an employee of the company.
Mr. Chair, you're looking for the owner.
Yes.
Honorable Yusuf is looking for a specific contractor, which is not fair. Because he's mentioned the managing director's name, and he doesn't want to.
Did I say the managing director? But that one will be registered.
It should be enough, Chairman.
Man, I asked the question, and I said we wanted to know the directors. I didn't ask of a manager. I know what I'm talking about. There's a difference between a manager and a director. Ownership.
Chairman, this is the managing director.
Chairman, we are
not just
a
a manager. The managing director.
Well, I've ruled on this matter already. I said the managing director could be an employee of the company. We want the owner of the company, who might be a director, a shareholder of the company. Yes. Paragraph 170, Honorable. Tomorrow we need that information tomorrow. Paragraph 170, Honorable Amakwata.
Thank you, Honorable Chairman. Honorable Chairman, here the alleged infraction is on the payment of an amount of 678,800 for the comparison of information on treatment and isolation centers and medical equipment in the various regions of this country. auditors see it as a duplication of efforts because this very information was already known to Ministry of Health. They were completely seized with this fact. But paragraph 172, the Director of Finance, in responding to this infraction, did say that they paid that amount and they undertook that exercise because the service needed its own independent data for their own operations. Can that be further explained to us?
Thank you, Chair. Yes, as a service, our remit goes beyond the regional medical source into facilities. And so for our own asset register and verification, we went also to check to make sure that we are able to properly account for them. And not just the equipment, how it's being used, whether we even have the appropriate personnel to use it. As you realize, some of the equipment that were used were packed or not used were because we didn't have the appropriate persons to use them. The second objective of that was what we call sustainable use. We have built, ministry had put up several isolation and treatment centers. The pandemic is over. We cannot just close them down. We need to repurpose them to use properly. And so we may need to look at all those facilities and say, well, I can give you an example, the one in the Zebila Nana becomes an additional facility for the old hospital to use. We convert some of them into either like a hospital, like I think there's one in Aflao also, where we use them and we tell them now you can use it for general purpose. This is no more an infectious disease center. So those were the works that was done. So it's not just with consultants to ensure that we are able to give them directive as to how and what changes needed to be done for it to be now used for the repurpose for what is useful now. And that exercise continues. And that includes what was done in Dodowa, among other places. Thank you.
Okay. Thank you. Honorable Chairman, I think that's reasonable explanation. In page 47, paragraph 175, I think it goes further to explain what you have said, that in response to this query, management said that Ghana Health Service comparison exercise is entirely different in objective, in focus, and in scope. May I know, in course of your work, since you work together with Ministry of Health, do you have areas where you harmonize your activities to avoid duplication when necessary?
Yeah, thank you. There are several areas we harmonize, and most of the time we also work
touching the matter in issue shall be the truth, the whole truth, nothing but the truth. So help me God.
Thank you very much, Honorable Minister. Kindly introduce yourself to the committee.
Good evening, Chairman. I'm Dakwa Newman. I'm the Member of Parliament for Kankwe South and the Minister of Gender, Children and Social Protection. Thank you, Chairman.
Thank you.
Chair, Dr. Fisa Zakaria, the Chief Director of the Ministry.
Hello, I'm Alina Parisidu, the head of accounts of the ministry.
My name is Nelson Togan, Chief Internal Auditor of the ministry.
And Honorable Chair, I'm Ken Boatin, Head of Treasury of the Ministry.
Sir Chairman, I'm Vincent Yebo-Esiama, Chief Accountant of the Ministry.
Kindly put up the mic. All right, so you have, I think, two issues in the report. Ministry of Gender, Children, and Social Protection. The first one is paragraph 202 of the report, and that will be taken by Honorable Roxon.
Chairman, thank you very much. Honorable Minister and your...
1 second. Chairman, please, can I leave for just 5 minutes? As the speaker is looking for me, and if I don't go, they are not going to take the bill, so please.
Okay, you
I'll
can
be
go,
back.
you can
Thank
go.
you.
Is it a third reading of the bill? Consideration, okay. Definitely with gender. And she's saying that the minister speaker is looking for her. Or we should wait for her to come. No, there will be issues that need a ministerial response. I know. It's not about the number of issues, it's about a number of the minister being present. Do we have Sanitation and Water Resources Ministry here? Do we have them? Which other ministry is here? Do we have the minister here? It's also not here. Call Dakwa to come back. Tell her the speaker doesn't need her. Honorable Aziz. Okay, Honorable Akwesi is calling her. All right, let's start. The minister will join us. Honorable Roxon.
Chairman, thank you. Gender, you are welcome. The case of the auditors is that the audit findings in question established that between April 7, 2020 and April 24, 2020, you receive some monies from the Ministry of Finance, totaling 12 million Ghana cedis. And in applying these monies for mitigating the COVID pandemic situation under your ministry, you procure the services of some caterers from the school feeding program, as well as an entity called Jofa Catering Services, to provide what the auditors describe as hot meals and such other services. Now, they again established by their findings that you made spot payments for the services rendered. ranging between 5,000 to 48,000. That is, according to the auditors, you paid some of these caterers 5,000, and the highest that you paid was about 48,000. Now, where they have issues is that these caterers, in acknowledging receipt of these payments, issued what they called ANA certificates. And they thought that it was not regular. Even where entities that were paid, like Jofa Catering Services, which we all know that they are well-established entity and can provide some documentation, they also acknowledge receipt of these monies with what they call ANA certificates. So let me find out how were these monies disbursed in the manner that the auditors found.
So much, Honorable
And
Chair.
what procurement method did you use?
Thank you so much, Honorable Chair. We did not use any procurement for the services. It was voluntary due to the emergency of the situation. People were asked to volunteer and they came forward.
So why were you paying for voluntary services?
We were only paying for the food, not their services.
But delivery of food is the service.
Honorable, yes, delivery
If
of
I'm a
food.
caterer, you ask for my service to provide you food. That is what I have delivered. So,
Okay.
So if I tell you that I've provided food or meals, hot meals, as you describe it, totaling 48,000 and you paid me, that is all you are paid for. What else were you hoping to pay for?
Honorable, well noted.
So we actually expended nearly 12 million Ghana cedis by what we call tabletop payment. We just paid the people cash, put the money on the table, paid them, no documentation, ANA certificates. Because we were under COVID, because you suspended the Procurement Act.
Honorable, the announcement was made on the 30th of March 2020 for the lockdown, and we were to provide the food the next day. That led to we using the honor certificate to issue to them, because we needed something to show that they were actually taking those funds from
How
us.
were these meals monitored? Who monitored the distribution? And how were they accounted for?
Okay.
And including how were the qualities authenticated?
The first day, I mean, due to the emergency of the situation.
So let me give you a
they
scenario
couldn't-
so that you address it holistically.
All right.
I volunteer to provide 2 hot meals or 1 hot meal to a group of people in a designated area, let's say Parliament House, then I submit that this afternoon I provided 1 hot meal to members of Parliament, and the cost is 1 million Ghana cedis. Who authenticated the process? Since everything was done according to you under emergency.
Yes, the first day it was done by the ministry, the staff of the ministry. But the second day we got disaster management, NADMO.
NADMO.
We got NADMO involved, so they were doing that together with some staff from the local government service.
So which documents did you rely on to pay these people? Or just by word of
Evidence-
mouth?
No, evidence of the food, because they verified the amount of food they were providing, and then they were marking them for those days. So it was based on evidence of the food, provision of the food.
So the quality of the food how were they also determined? Because the quality determines value.
The quality was good because during the lockdown, our ministry, we were working, we worked 24/7, and we equally ate some of the food. So I can testify that the quality was good.
By word of mouth.
I mean, evidence, because I ate some of the food together with the staff who were working 24 hours a day.
12 million Ghana cedis. Chairman. Chairman.
Honorable Kofi.
Chairman, thank you very much. Chief Director, you indicated that you didn't actually pay them, but then it's for the food. You didn't pay them for their service. So if it's for the food, if a caterer is, say, using a bag of rice or 2 bags of rice, they will surely be purchasing this rice and they will be receipted. Why did you not rely on those receipts of at least the rice and things that they told you, oh, maybe I bought these quantities of rice for this? Why couldn't you have relied on that and you have to depend on their honor certificates, which is so difficult to prove and certify?
Honorable, during the lockdown, it was really difficult to use the normal processes to authenticate these sort of receipts and bring this. It was really difficult. And we needed to feed the people, you know. So it was really quite difficult getting those receipts from them. And when it came to the cooking, some voluntarily cooked with their own monies. Yeah. No, they did not. Some cooked out of their own evolution, just to help, because the lockdown was on and people needed to eat. Our call center was so active, people were calling in for food. So, I mean, it was a situation I saw that all Ghanaians were on board, all hands on deck, yes.
Madam, we were told during the COVID time that the people were supposed to be provided with hot meal as well as food stuff, which were not cooked. The 12 million involved here is the entire 12 million for payment for hot meal, or it also covers the uncooked food that we are giving out to some of these people?
Honorable Chair, for the hot meal.
For the hot meal. So did you also make any payment for the food that were supplied to these people? Or that was handled by another agency?
Uncooked ones?
The uncooked one, yes.
Well, a lot of people donated, and we have records of that.
Okay, so we can say that for the food that were given to these vulnerables, they were all hot meals.
Yes, please.
Now, you only pay for the food.
Yes, sir.
You didn't pay for the services.
No, sir.
Did you buy the food and give to the caterers to cook for the people?
No, sir. We did not buy the food for them.
So you asked the caterers to go and buy the food,
Yes,
and then
they did.
cook for the people, and then let you know the cost involved, and you pay them. Is that the case?
We were paying per pack. There was a standard pack for the food.
Pack for the food. So the pack like a takeaway, we know in Ghana.
Takeaway, yes.
So that is the cost of the food that the caterer is selling it to government. So you can't say we are paying for only the food. the services or his or her profit is included in that cost of the park. It's built up in it. So you didn't pay for only the food, the cost of the food. It's everything inclusive. Okay?
Well noted.
Now, the honor certificates. Do you mean to say that all recognized caterers in Ghana don't have receipts to issue for any money you pay them?
Honorable Chair, we treated them as a group, and it was voluntary. We did not go into a formal agreement, a signed agreement with them. So it was voluntary, and we treated them as a group. We did not look at who has a receipt and who did not. So we're using the
If I walk to any restaurant like Jofel and eat, and I demand a receipt, can they get a receipt for me?
Yes, Honorable Chair. Jofel can.
Did you ask them to give you a receipt for all the money you paid them?
No, sir.
Why?
Jofel started providing meals before we even engaged them to cook.
Yeah, no.
For a wider group.
Aside that, I only want to know if it is 10 cedis you pay them or 20 cedis you pay them, did you demand receipts?
No, Honorable, because
The question
rest
is
were
why.
not
The question is
demanded.
why. Why need to demand receipts?
Honorable Chair, we did not demand for receipt because the rest of those cooking were not asking for receipts.
But you asked for honor certificate.
That was what.
That
we
is you
used
right.
for-
I have
for
received
them
this
all.
money from the Ministry of Gender, Children and Social Protection.
Yes.
That one, you demand that one.
Yes,
But you
Honorable.
didn't demand receipts.
Because majority could not provide receipts.
No, madam, no. You can't speak for them. Caterers in Ghana have receipts that they can use to issue for any payment they receive. We can agree that entire 12 million cedis honor certificates. No. School feeding caterers have receipts. And you use most of these caterers. And you decide to demand honor certificate instead of what? Receipts? No. It's not acceptable. Now, paragraph 206 says that we also noted that 1,556,800 Ghana cedis out of 3,999,920 Ghana cedis paid to caterers in 110 transactions relating to delivery of hot meals were certified and paid in all instances by the same NADMO officials within each of the sub-metros and KMA in Greater Kumasi. So you have paid them, but also NADMO also paid them same. Is that not double receipts?
No, Honorable Chair, we worked with NADMO.
Okay.
So it was one and the same thing.
Yeah. Yes, you paid them 3,999,920. That add up to what you pay Greater Accra, which is 7,999,524. It is the two put together that is close to the 12 million. So we have accounted for their receipt of the money as part of your expenditure. But the report is saying that NADMO also paid them 1.5 million. So they have received money from you and at the same time received from NADMO.
Honorable Chair, Can I kindly pass on this to
Yes.
the auditors?
Any
so that-
auditors, can you confirm this, my understanding of the paragraph 206?
Thank you, Mr. Chairman. Actually, it wasn't double payment. What happened that there wasn't segregation of duties. The same NADMO officer who certified was the same person who was doing the payment again. So the issue was about
I don't
segregation of
understand.
duties.
Come again.
The issue was segregation of duties. The same NADMO officer who certified the transactions was the same person who was doing the payment again. So they didn't segregate the responsibility.
So it means that the entire 12 million was not money that was paid by the Ministry of Gender alone. A portion of that was paid by NADMO. Is that the case?
What happened was that the ministry transferred 3.9 million to KMA to take care of Greater Kumasi. So NADMO was the officer who was certifying the transactions. But in this instance, the NADMO officer who was certifying the transaction for the ministry to pay, assuming it was Accra here, they will certify and the ministry will pay. But at KMA, the same NADMO officer who was certifying the transaction was the same person who was doing the payment. Yeah, that was the problem.
Was the money transferred to NADMO in Greater Kumasi or to the assembly?
To assemble, to KMA.
So assembly decided to use the NADMO officers who certified, use the same people to do the payment.
Yes, that was what happened over there.
So there could be some kind of collusion or not. COVID had made some people rich. Oh.
Yeah, Mr. Chairman, thank you. The NADMO officers I know work under the district assemblies, and I know the ministry collaborated with the district assemblies. So I want to find out whether the chief executives or any other officer did not certify what the NADMO officers presented for payments, because he cannot give you a list and still certify that I serve this number of people. So since you collaborated with the district assemblies, I just want to find out what role the chief executives or the heads of department played in this whole exercise. Should I respond? Yes. Because I know that you worked with the district. In Kumasi, for instance, you worked with KMA, the chief executives, other officials were involved. So it wasn't just the NADMO officials who gave out the list and still certified them for payment.
Honorable Chair, with your permission, could the Honorable Frida assist us with this? Because she was assigned to Kumasi.
Frida, I'm not going to allow you to even speak again. Well, honorable members, we are actually laughing, but for me, it's a serious offense to spend 12 million of the people's money and just write, I have received this money. And that is the end. If it's a receipt of a company, at least it can be traced. At least if there's some profit made, some tax component can go to government and all that. But on a certificate, that's the end.
And one person can sit there and generate all this.
And in fact, one person can sit and write all the honor certificates. There is no evidence that it's actually signed by the caterers. it's terrible. It's actually not good. We will make a strong recommendation to the House to debate this issue. Paragraph 212, Honorable Aziz.
Thank you, Chairman. Chief Director, the infraction here has to do with, I think it's just a follow-up on the what Chairman just said, unsatisfied payments. I mean, they made payment without certification. Though, like you were explaining, we were in a critical situation. And Chairman, with your permission, I would like to commend the caterers who volunteered to provide this service at that period. Yes, we must commend them for what they did voluntarily. Though, Chief Director, there's a recommendation here that you must take notice of. We recommended that the Chief Director should not sacrifice accountability for agency, but always ensure that sufficient controls are in place at all times to guarantee accountability. I can say that was your first experience. My next question is that, have you ensured that you have put up some control measures moving forward?
Yes, please, Honorable. We have set up a national social protection shock response system.
Okay.
Yes, and we have a strategic document in place.
Okay.
So that in case of any emergency, then we'll use that.
Have you made this your document available to the auditors?
Oh, we'll launch it soon.
You will launch it. You are yet to launch it.
We are yet to launch
It's still in the pipeline.
Yes, but we have developed that.
Oh, okay. You need to, let it out.
Yeah. Okay.
So that.
We can share the draft with the committee.
Okay.
Yeah,
That's
we have
okay.
it.
And make a copy available to the auditors. Okay. Chairman, they are putting up measures to ensure. What is it? To ensure that the right things are done. Yes, thank you. And that's their first experience. It's
thank
not
you,
good.
Honorable.
Well, Honorable Aziz.
Your time will come. Your ministry is coming.
You've done your best. But you see, this is not an issue that we should be laughing over. If this were to be other countries, people would go to jail in this matter. Definitely people must go to jail. Honorable Yusuf.
Chairman, thank you. Chairman, I think that we should learn a lesson from this. Because I was just trying to find out from somebody, is there any law that one could use against those who have done this certificate of... Now, if we want to ensure that this thing doesn't reoccur, then there should be, like they are doing, a structure in place to ensure that next time nobody uses this system of certifying for expenses that are being incurred. Because if you do that, anybody can sit in the house to generate some of these issues. But like the deputy minister, where is he? I think that's why he was appointed. He's done very well. He's here. So, Chief Director, the document that you are putting in place, let's ensure that there are mechanisms within that document that will not allow people to go ahead with such practices going into the future. I think it's a very important issue, and we'll have to look at it. Thank you.
Thank you, Honorable. Well noted.
Well, We'll do our recommendation to the, so you hear from the committee through the report that will be issuing to the House. On that note, you are discharged.
Thank you so much.
Let's have Ministry of Sanitation and Water Resources. We'll take it. Ministry of Sanitation and Water Resources. And this must include also Ghana Water Company. So you are all under.
Please, are we ready? Hello. Please repeat after me.
I, Lydia Seriam Al-Hassan,
Do in the name of the Almighty God swear
do in the name of the Almighty God swear
that the evidence I shall give before this committee
that the evidence I shall give before this committee
touching the matter in issue
touching the matter in issue
shall be the truth,
shall be the truth,
the whole truth,
the whole truth,
and nothing but the truth.
and nothing but the truth.
So help me God.
So help me God.
Thank you very much. Kindly introduce yourselves to the committee.
Lydia Seriam Al-Hassan, Member of Parliament for Ayawaso West Wuogon, and the Minister for Sanitation and Water Resources. Thank you.
Aloysius Ajete, CEO, Community Water and Sanitation Agency.
Anthony Jajira, Director, Policy Planning, Monitoring and Evaluation, Ministry of Sanitation, Water Resources.
Clifford Brahma is my name, MD Ghana Water Limited.
James Anete Abe is my name. I'm the General Manager, Finance and Administration, Ghana Water.
Thomas Wensa Bobby, Acting Chief Manager, Finance, Ghana Water.
Collins Nontrinuyama, General Manager, Special Duties, Ghana Water Company.
Peter Divier, General Manager, Operations, Ghana Water Company.
Thank you very much for coming. We'll start with the main ministry, Ministry of Sanitation and Water Resources. Funds released to the ministry, 18.0 million Ghana cedis. The auditors say that paragraph 24 of update number 5 of the President Address to the Nation of 5th April 2020 on Ghana's enhanced response to the coronavirus pandemic emphasized cleanliness of our country, especially in the Greater Accra and the Greater Kumasi areas, which are currently the subject of the restrictions. It indicated that the Ministry of Sanitation and Water Resources, together with 400 personnel drawn from the police, military, fire service, and prison service, had from 3rd April to 5th April 2020 embarked on the silting of gutters, collection and disposal of garbage from homes, public places, markets, and vehicle terminals. In respect of the presidential directives, the Ministry of Sanitation and Water Resources was provided with an amount of 18,088,395 Ghana cedis to conduct the cleaning exercise. Before I come to the ministry, auditors, what is your recommendation on this observation? Auditors, I'm waiting on you. Is there any recommendation? You have observed that they are giving 18.088 million. Just for the information of us, so that I can move to another one.
Mr. Chair, it's a preamble.
It's a preamble.
Yes, thank you.
I have noticed that paragraph 340 is talking about that amount. So where you place the preamble is wrong. Should have been part of the paragraph 340. Okay, so once it's a preamble, we'll go to the next one. Paragraph 335, payment for non-certification of works, 5 million. The auditors reviewed the contract management and payment that disclosed that an amount of 5 million was paid to Dredge Masters Limited for the removal of plastic waste and other foreign materials or debris from storm drains in Accra without certificate of work completed. They also noted that although Dredge Masters Limited provided pictorial evidence of work done in Galloway, Chemu, and Nima drains, there are no certificates of work completed to authenticate the pictures supporting the work done. The auditors say that to give assurance that payments are made in accordance with the value of works delivered, the level of quality required in accordance with specifications and acceptance, they have recommended to the Chief Director should ensure that all payments for works are authenticated by certificate of work done, duly signed by the project engineer before payments are made. Management has responded that the ministry has undertaken a number of dredging exercises and has always relied on the inspection reports to process payment. Management also stated that the dredging became necessary under emergency circumstances to put in place safeguard measures against the spread of the COVID. So it means that you've been doing the right thing. So what auditors have quoted is actually not relevant. Is that the case? Ministry of Sanitation and Water Resources. You've been doing the right thing, that you depend on the inspection report to process payment. While the auditors are saying that you should have certificate of work done. What are you doing now?
They gave a, thank you, Mr. Chairman. They gave a number of recommendations, and we have taken note of the recommendation and for compliance in future contracts. Thank you very much.
Honorable Minister, I know you are new in that ministry. You can ask the technical men to respond.
Thank you very much.
Okay.
Thank you. So, be careful. Be careful. Mr. Chairman,
Yeah.
my chief director is not available, and Mr. Jadra would represent him. Thank you very much.
He can respond. All right, let's move to the next one, paragraph 340. Contract awarded without performance bonds, 18 million and 88,395. So there are about 5 contracts without performance bonds. The recommendation is that the chief director should ensure that high-value procurement contracts are adequately supported with performance bonds issued by financial institutions, licensed and regulated by the Bank of Ghana. This is a recommendation for future compliance. Are you now complying with this recommendation?
Mr. Chairman, we wholly agree to this recommendation and we are complying. Thank you.
Auditors, have you done any subsequent follow-up to confirm that they comply with this recommendation?
Honorable Chair, follow-up shows that they are now complying. Thank you.
Okay, paragraph 3241, Honorable Roxanne. That's Ghana Water.
Chairman, thank you very much. Doc, you are welcome.
Thank you very much.
The case of the auditors is that, of course, again, the auditors would reference that famous update number 6 by the president to predicate their findings. They are saying that you receive some support, and they said they review all the bills submitted to the Ministry of Finance by water that you supply to the people, which was as a result of the President's directive that you should supply water freely. And as of between April 2020 to June 2021, it disclosed that two of the costs totaling 21,348,068 Ghana cedis did not relate to actual bills expected to be paid by the Ministry of Finance. Now, how do you clarify this matter?
My deputy in charge of finance will take the lead, and if there is the need, I'll come in. Please. Thank you.
Thank you, MD. Yeah, when the president gave the directive, there was a meeting between Ministry of Finance, our sector ministry, that is Ministry of Sanitation and Water Resources, and Ghana Water Company Limited. We sat down to carve out the modality under which this free water will be given to the Republic, the people of the Republic of Ghana. And what we did was that our technocrats went around and identified vantage places where we could mount polytanks so that we can serve the populace, those who are deprived. Honorable Chair, it was in twofold. The polytanks were mounted at places where our pipeline water supply goes through. So within that jurisdiction, we were able to connect our pipeline into those polytanks. But there were also places which were remote. They were out of the outskirts of our jurisdiction. So we also mounted the polytanks there. And then we engaged the services of tankers to go and then discharge water into those, those polytanks. Actually, the polytanks are 10,000 liter capacity. And those polytanks must sit well. So as a result, we had to look for, professional masons to, construct a platform so that these polytanks can sit well, so that we can do the supply. So it was as a result of this that we paid the tanker service providers. Actually, they will bring way bills, and it is authenticated by our internal auditors before the payments are done. So that is how come that we incurred that expenditure.
Engineer, if you, okay, Director of Finance, right?
Yeah.
Okay. If you listen to the concern of the auditors, they are saying that of the bills that you sent to finance for payments for water supplied per the executive directive, they dictated that 21 million, some two cost elements amounting to 21 million, were bills for which you were requesting for payment, but they dictated that they were not related to the water supplied per the guidelines. If you read what they wrote.
Honorable Chair, if I can just quote an excerpt of the President's directive, and I quote.
You hold on. Let me read what they have written. Then you can further clarify. Our review of COVID-19 records showed that on April 4th, 2020, the Ministry of Finance released an amount of 200 million to the Ministry of Transport to Greater Accra Passenger Transport Executive.
Please,
sorry.
You are reading a different
Sorry. Now, let me read paragraph 242.
Yeah.
In view of the presidential directive, the Ministry of Finance and Ghana Water developed policy guidelines to guide the provision of free water for all Ghanaians. Okay. Our review of bills submitted to the Ministry of Finance for payment covering April 2020 to June 2021, however, disclosed that two of the costs two of the invoice, let's put it that way, totaling 21 million, did not relate to actual bills expected to be paid by the Ministry of Finance. This is what the auditors are saying.
Mr. Chairman, these costs are incidental to the provision of the water to the people of Ghana.
Exactly. So
Without
tell the
that-
committee what these incidental costs were. Because they are saying that it's not related to water.
Okay.
Honorable Chair, the policy to get water to everywhere in Ghana requires that whether we are connected to the area or we are not connected, we should provide them water service. Areas where we are not connected, we need to erect polytanks. Who pays for the polytank? Areas where we are connected, but we don't have regular flow of water, just to bridge between the period of flow and non-flow, there's the need to erect a polytank. You have to buy those polytanks, and that's a cost. For you to get the polytank sitting properly so that people can access the water, you need to build a platform, and the platform must be paid for. And so for us to be able to deliver the directive, these costs must be incurred. Ghana Water Company on its own, there's no way we would have put our hands in getting some of these items. And we think that once it's a state policy, then it has to be paid for by the Ministry of Finance.
Let me get back to the auditors. Now, in the course of the audit, did Ghana Water render similar explanation to account for this seemingly unrelated cost element? For instance, the cost of cement to erect the platforms. Did they explain it to you this way?
Thank you very much, Mr. Chairman.
It's countrywide.
I think that if you look at paragraph 243, it's talking about the 21.348. It's referring to 1, compensation for special commercial customers, and compensation to tanker drivers and operators. The tankers, the mounting and installation and procurement of the water tanks is in paragraph 246. So we are referring to two different things. The installation and procurement of polytanks is captured in paragraph 246. However, the table that we have provided is in respect of compensation for special customers, special commercial customers, and then compensation to tanker drivers and operators, which amounted to the 21.348. Thank you, Mr. Chairman.
Okay, Auditor General, how do you conclude that a compensation paid to a tanker driver who conveys water, fresh water, from, say, Dodi to a community in Southern Kaira during this period does not relate to the free supply of water? How do you conclude that? Because it is related. It's the tanker driver that brought the water to the people.
Mr. Chairman, thank you very much. We're talking about the bills because the tanker drivers and special customers has to provide an invoice to Ghana Water Company for it to be the basis for them to claim the amount. But in the review of documentations at Ghana Water Company, we did not see these invoices from the special customers and tanker drivers. That's what we are relating to.
Ghana Water, now they have clarified why they labeled this cost element as unrelated. So during the audit, so let me ask, during the audit, did you provide when they raised this issue, did you provide them these relevant invoices from these service providers who help to distribute water to?
Honorable Chair, we provided. Yeah, we bills together with their bills certified by our internal auditors before we pay, because all the regions will submit those bills to head office. Head office will look at it, relying on the auditors in those regions, and then based on that we pay. So we had a file of all those. Those things.
Okay. You see, the amount involved is quite huge, 21 million. So would you be kind enough to supply copies of these invoices to the committee? Similar copies that you gave to the auditors?
Mr. Chairman, we can supply.
For our study and action.
The documents are.
Yes. No, I've already established from the auditors are certain that they did not provide. That's why they concluded this way. And they are saying they have provided. So we want to see the copies of the documents they provided. If it's necessary, then the committee will ask the auditors to come back to look at it. Chairman, may I defer to you for timeline for Ghana Water to make available these invoices, certified invoices to us?
They can provide them tomorrow.
Yeah, Mr. Chairman, we can provide tomorrow.
Honorable Mutala.
Thank you, Mr. Chairman. Uncle, I want to find out how much Ghana Water Company spent in the provision of the free water to the citizens of this country.
I have something small here. We spent almost 700 and
how much did they pay?
The bill was this, and then they paid 731 million. See?
No, we didn't get it over. We got over 800. I think the numbers are mixing up, so we might not be able, since we were not asked to answer those ones here.
No.
So we can get the figures, actually what we presented to Minister of Finance and what they paid. Because it's not all the invoices that we sent to them that were actually honored. So there are two different things. So if you are not careful, we might give conflicting numbers here.
Mr. Chairman, I may not necessarily be interested in how much they have honored. You provided the citizens with the water. You know the total cost involved. There is a cost element of any quantity of water you supply to citizens of this country. I just want to know the total cost of the water you supply to citizens in the name of the free water during COVID. That's what I want to know. Not necessarily how much was honored by the Minister of Finance. I want to know the total cost. The issue of how much was honored, that one is another matter. I just want to know the cost involved in the water you supply to citizens.
Mr. Chairman, the MD just responded that it was not part of the question that was asked for him to prepare for it. He said that he will go and get it and bring it back tomorrow. So for him to be insisting on this, it's not part of the questions that we were asked to come here to respond to.
Mr. Chairman, Honorable Minister.
Hold on. Honorable Minister, we have what we call public interest question, which will completely be outside the issues in the reports. So whether it is an issue that you are supposed to respond or not, once it's bundled on the public interest, we allow it. So, Minister, take note. The next time you are coming, prepare outside whatever you have in this to cover your area or your entire ministry. So, Mutala, continue.
Thank you, Mr. Chairman. My last public interest question. Dr. Clifford Bremer. We had a challenge with water supply in Tamale Metro. I filed a question inviting the then minister to come and provide answers to the people of Tamale, a place you lived for several years, actually. The minister came with you, and the minister assured the people of Tamale that the water crisis were going to be a thing of the past. I had subsequent conversations with you. Some assurances were made. Unfortunately, the water was not provided. The people in Tamale Central and Tamale Metro are still struggling. Could you tell the people of Tamale Central who are keenly watching, because I informed them that you will be coming, who are keenly watching, to find out why the promise and assurances you gave, which are laid to them, said, your brother has given the assurances, your son, your grandson, all the elderly. Could you be speaking to the people of Tamale Metro why the water was not provided?
Thank you very much.
Order.
Thank you very much, Honorable Chair. Honorable MP for Tamale Central, I thought we would have finished why we are here, then we can have the public interest. But once it has come in, we will want to.
No, your issue as the Ghana Water Company is finished. That is why I've allowed him to ask the public interest question.
Oh, I see.
The next one will go for community water.
Oh, thank you very much. Honorable MP is aware that we had done all the processes in getting the water to Tamale. Unfortunately for us, Parliament approved, all the commercial contract signed, all the documentations completed. Our documents couriered to Deutsche Bank for them to give us the directive that the project will come to life in a particular day. Unfortunately, the debt exchange issues came up, and all the banks held on to releasing the funds to us. That is the only major handicap as far as is concerned. The pre-feasibility, feasibility, everything has been done, and the document currently are with the bank. Even when we sent the document, they saw some mistakes on them, sent them back, we corrected them with Ministry of Finance, returned them, but they haven't asked the contractor to move to site because they will not give the advance payment. That's
So it is very clear that the people of Tamale Central, Tamale Metro, must not blame you entirely. It is as a result of how messy and disastrously the economy of this country is being managed. Oh no, but he himself is saying that they did everything they needed to do. If the economy was not messed up, I think that we would have had the water. It is very clear from the horse's own mouth.
Honorable Chair,
that's my interpretation. Anyway.
Honorable Chair,
it's my interpretation.
Yes, but Honorable Chair, I think we are moving outside technicalities to other issues. Even the water that we have in Tamale, if we had cooperation from the citizens, I hope they are hearing, because I visited Tamale and told them that with the volumes of water that gets into Tamale, if we are disciplined and we are not trying to take water that is not supposed to be ours, people should get water in Tamale at least 3 times a week. When we went to, just a minute, Honorable, when we went to Kukuo, one of the days that we opened water towards Kukuo, from 7 a.m. to 2 p.m., people were not getting water because citizens had inline pumps in their homes. You send the water, they draw it into their reservoir. So I went out with the police and our operation control team. The first place that we saw the inline pump, when we took it out, the next house around 2 started getting water. They are listening to me. That within a very short area, we took out 5 of those pumps. What it means is that when you send the water, they have big reservoirs. They take all the water into their reservoir. And when these people don't get, they now sell it to them. And so we are doing our own selves. Even when we don't have 24/7, we have receptacles to keep water. Ghana Water Company will be able to send water, some volumes of water to you, and you can at least get not less than 3 times a week. That's calculation we did. I met the assembly in session, met the regional minister, I met my staff, and we all agreed. Today, we're trying as much as possible to ration the water for them, but we want the citizens to also help.
Mr. Chairman, I frankly speaking, I take serious exception to the statement you made when you said, and I take serious exception to this, when you said that if the people were disciplined. I have seen information, reports of people who engage in illegal siphoning of water, even in Accra. So for you to use one broom to brush the people of Tamale, you said that if they were disciplined, please
that
let me
is
finish.
those who are stealing the water. That those who are stealing the water, please.
I listen to you. Let me finish. I listen to you. Please let me finish. I take serious exception, and I'm providing the committee with this information. I'm providing the committee with this information to debunk the notion that the water that is in Tamale could. I'm providing this information. 2015, when I was the MP for Nantong, I got pipe-borne water from Tamale to Zhang. It got to a time that the water was no longer reaching Zhang. I went and met the Ghana Water Company, the head there in Tamale, and he told me that it was going to be difficult because the source of water for the people of Tamale, the population has increased until they provide another source of water, that it was going to be difficult for them to provide water to supply the residents of Tamale. And in fact, when you appeared at Parliament with the former minister, she also reiterated the same point, that the reason why they are not able to provide enough water to feed the metropolis was because of the population increasing. But for you to sit here and then you say that you have enough water to supply the people of Tamale, but because, please, it's absolutely not true. But let me, please. He didn't speak Dagbani or Gonja, he spoke English. So I'm saying that for you to say that, but because of certain individuals who engage in illegality, those who engage in illegality, that is the reason, please, that is the reason why water is not being supplied. It's not true. And for your information, the people of Tamale Central largely depend on a borehole facilities are provided. So that is not true.
Honorable member, you've made your point. Mr. Doctor. Oh, honorable member, you have made your point. Dr. Brown, the statement you made, the interpretation given by the member for Tamale Central is that he has taken exception or objection that the use of the word, if the people were disciplined. So I'm giving you the opportunity to clarify the situation.
Thank you very much. I'm sorry if he's taking my statement out of context. Even that day at Kuku, I mentioned that to the people who did that they were punishing their own people by what they were doing. So I don't refer to the whole of Tamale, but the people who specifically are doing that. And water supply is not like going to construct a road. If 10 people are moving on the road, you do the same as 100 people. If you are going to do a road for 1,000, it will be the same as the road for 100. But for water, because the infrastructure is in a particular form, you have to continuously renew and change. 24/7, we will have to add water. But it doesn't mean that the current volume of water, when you do your analysis, you cannot find a way of making it more efficient today whilst you are waiting for the bigger project. And that's exactly what I was just trying to. And he can confirm that when I went back to Tamale and we looked at the issues, things have improved, but not to the level that we want. And that we are working on that. And if we don't take the inline pumps out, even the volumes of water that we have, we might not be able to distribute them properly. If he took my word out of what I meant, Honorable, I want to withdraw that one.
Thank you very much. Thank you very much. Honorable Rankin.
Yeah, thank you, Chairman. Mr. Brahma, I just want to thank you very much. I spoke to you about extending water to a group of people in my area. And that's just about, look, why? That's just about 3 months ago. And the people are happy that the water is now flowing in that area. Thank you very much. But Chairman, I haven't finished. So there's only one recommendation here that I don't know whether you can respond to it. If you look at, oh please, you can't put your words in my mouth. Please be. I look at paragraph 248, where you bought a number of tanks, about 640, for various communities, 645. And the recommendation is that these tanks should be, if like, converted somehow to serve the people in the area. Do you agree? And if you agree, what have you done about it?
Honorable Chair, we don't agree. And that is why we are requesting that it should be paid for. These are emergency facilities. We don't do emergency interventions. And so, because we had a directive of carrying out that emergency situation, we incurred that cost. Today, the tanks are idling, sitting at our head offices. And I'm sure NADMO would have served NADMO better or national security, because they have these rigs that go to drill boreholes, and they could use them at that time. So the state, if the Minister of Finance or the auditors had approved for that payment, would have released them to either NADMO or whoever the Minister of Finance would have directed us to release. Because they are currently sitting there and used, and I'm sure the NADMO people would have been willing to use them.
But the items has already been bought, right?
Yes.
And paid for.
And paid for, and we want a refund from the Minister of Finance. Because we use our
COVID funds to buy
we use our operations. No, we use our operations money to buy it. So we have denied improving our system for that. And that's why we were thinking that if Minister of Finance refunded it, we would have used it to cover our finances and then to give out the tanks.
Okay. Thank you very much, Chairman.
So why not community water? Your brother.
It is not paid for. It's sitting there. But if it was paid for by the state, another state agency can come and use it, because the only source of revenue to Ghana Water is our tariff. And these items were not captured on our tariff. And so we have to deny ourselves some activity to be able to finance that one. So we've been denied.
Okay. Thank you very much. Paragraph 249, Honorable Akwesi. We know that he has been helping all of you, so you have already thanked him. That's all. Akwesi.
Chairman, thank you. Chairman, this, mine has to relate to community water and sanitation agent. It is also on the cease update of His Excellency's address during COVID-19 on the 9th of April 2020. And it has to do with the total amount of 70,301,074 Ghana cedis released to community water for water that they provided for people within their operational areas. That totaled 47,491,000 and another 22,819,000 for other NGOs, private water providers. But of importance, community water is the auditors finding that about 14 million that you paid were not based on actual bills, but they were based on estimated bills. And they recommend that you develop a suitable method and approach where actual water consumed can be ascertained and that used. This was based on the fact that you also used the maximum pumping capacity of these machines to estimate your bills, which we know it is not a possibility. But however, there is still an outstanding amount of 14,789,000, which you say that if it's not paid, and you are also not able, the agency finds it difficult to convince community water and sanitation and other providers to provide waters to in the future emergencies if these amounts are not paid. What is the situation of this outstanding bill?
Thank you, Mr. Chairman. I think in trying to ask your question, you mixed up one or two things. What it is that 14 million is outstanding. And the story is like this. Community water provides water, and we have a billing software. Some of these private people too have billing software, but most of them don't. Because if somebody has a small borehole in their house in some small town, and they sell their water, people bring their buckets to fetch and to pay. That person will not have a billing software. And so for these people, the district assemblies verified what they provided within the period of the free time, you know. And then now, when the district assemblies verified and certified, it goes through our regional office to also be verified, and it comes to the headquarters before it is sent to the Ministry of Water Resources to pay. Some of these people, because they did not have this billing software, we had about 37.609791.71 million from these people, which were certified by the district assemblies, who are in the towns and villages with these people, and they certified how much free water they gave out. You see, these people don't have bills to show, because it's even difficult to even maintain a billing software for even CWSA. So these people don't have a billing software, and for that matter, cannot provide bills at any point. And out of this 37,000, even 22 million has been paid. So I don't understand why this 14 million is now, it is now that we are being told that because they don't have bills to show, they cannot be paid. Now, what I have been told is that my predecessor even told them when the issue came up that he was prepared to offer them a vehicle to go to the grounds themselves to verify, but they refused. So I am appealing that because some of these people have been paid, even 22 million out of the 37 million has already been paid. So for this 14 million to be outstanding, it becomes, I don't know. So that next time, if we need free water for people, some of these people in the areas where community water cannot go, and then they are the ones providing water for these people, decide that they won't do it, then it will become a big issue for us. Thank you.
Later, don't be amazed. You said community water, you bill, and you have a billing system.
Yes, please.
But those ones don't have a billing system.
Yes, please.
So obviously, anybody who is to pay would pay the ones that have billing systems in place. That can be verified. But those that are not billed, but only is based on the honor of people certifying, that becomes a difficulty for anybody to accept that and pay. So you can appeal. But don't say the glamour figure and the total figure of 37, because part has been paid, you find it amiss. So you can appeal that because those were certified and at the time it was in need, there should be a way for us to speak to that for that to be paid. Yes, because you never provided bills for that. Did you provide?
Thank you, Mr. Chairman. No, sir.
Good.
But I take what you said. I am appealing that for the sake of their jobs, because that is the livelihood of some of these people in the villages and small towns, that they are paid this money. Thank you.
So what have you done over the years or the period that you took over about this 14 million? Has there been any reminders, engagement with the
yes,
people
please. And I'm still doing it. So I'm still using this medium as well to also help me appeal for these people to be paid.
Chairman will keep appealing for them to get it paid.
Yeah, this is the money that should be paid by the government, not the community water. Minister of Finance, are you here? When are you going to release money to Ghana Community Water to pay these people? Ministry of Finance, take the seats and respond. When are you going to release funds to Community Water so that they can pay these people who provided free water during the COVID period?
Mr. Chair, following from the audit recommendations, the recommendation was to put a hold on the release and the further processing of that. Once we get clearance to go ahead, I'm sure management will take a decision on that. Thank you.
No, let me read what the auditors have said. We recommended that the outstanding amount of 14 million should be paid based on actual bills and not estimated bills. Okay, so the issue now is these people cannot get the actual bills. They can't get the actual bills. It's only the estimated bills. The portion which was paid, was it based on actual? Auditors, it was 37 million and you paid 22 million. Was that based on actual bills? Auditors, was the payment based on actual or estimated?
Yes, so, Mr. Chairman, when we made our review, we noted that out of the total, we were able to confirm some bills that Ghana Water, Community Water itself has some of the invoices that came from various districts of Ghana Community Water itself. And so we certified the 37, the 22.819 that was paid. But for the 14, we couldn't get the actual bills. We're giving the estimated ones. Thank you.
So you are trying to tell the committee that the 22 million which was paid was actual bills?
Yes, Honorable Chair.
Community Water, can you confirm this?
Thank you, Chair. It's not the case, Chairman. What the audit themselves have done here tells us that 37,000 did not have actual bills.
37 million.
37 million did not have actual bills. And what they have paid out of the 37 million is the 22 million, and there's 14 million outstanding. So I'm at a loss as to how they will write something and then explain it in a different way.
Yeah, I think I agree with you. Paragraph 252. We also noted that the NGOs and the private water sellers provided estimated bills and submitted same to the agency, which were vetted and arrived at a total bill of 37. So auditors, this You yourself said they are estimated. They are estimated.
Yes,
So the entire amount is estimated, not actual.
Yes, Honorable Chair. We divided the payment into two: the community water itself and the NGOs and private sector.
No,
So-
I've seen it. I've seen it. The portion that relates to 37 million is for NGOs and the private sector.
Yes, so
The
before,
community one is separate. We are not talking about that one.
Honorable Chair, thank you very much. The 37.6 million was actually estimate, but the 22 million that before we've gone to community water, 22 million has already been paid.
Before you went there.
Yes, Honorable Chair.
So it was based on the estimate, not the actual.
Yes, Honorable Chair.
So it is not clear. So once you have paid 22 million based on estimate, why don't you want to pay the 14 also based on estimate? Yes. So it is the position of the committee to recommend that the Ministry of Finance find money to the community water to pay these NGOs.
Thank you, Mr. Chairman. I'm grateful.
Thank you. Yes, Clifford.
No directives was given for payment to Ghana Water. No, that's different. And there was an item I think Chairman didn't allow us to clarify.
Okay, which one?
The number one, which is a compensation for special commercial customers.
Yes, yes.
Yes, these are customers who they resell water taken from Ghana Water. And we call them commercial water sellers. We charge them a commercial rate, they top up a 20% and sell to the end user. But today, government says they should give to everybody free. And so we cannot give to them, we can't get anything to them if we do not add what they had added for themselves, because they invest in those infrastructure, not Ghana Water. And so if you charge them, they also have a top-up to recoup their investment. And that's what we call the compensation. Because this time, they are not going to sell it to the people. We want that same money to come so that we'll be able to compensate them. Otherwise, they will even stop people from coming to fetch water from their homes. And that was the only way we could get them to open their gates for people. Individuals were going there and they were still collecting money from them. So we had to stop all those things. And once you stop it, the person's source of livelihood cannot also be cut. And we cannot take money from what ordinary would have taken from them and then pay back. Because if you look at what the auditors are saying, they were putting the standpipe issue and the commercial. Half of the standpipe is our infrastructure. So when they collect the money from the citizens, we give them 20% and take 80%. But for these particular ones, they invested in that infrastructure. So when you sell to them, they resell to the customers at a rate higher than what we sell to them. And today, if you want them to give it to them for free, then you should as well be catering for the additional revenue they make for themselves.
So how much is your demand you are making on the ministry?
Total is 28.5 million.
Oh, that is the figure we have
Yes.
on page 62.
Yes.
Now the special commercial customers,
Which
the
is
compensation,
13.8.
and then the tanker drivers and
7.5.
operators, and then your own installations. These are all COVID
Related.
related.
Yes.
Yeah, so we are going to direct that the Ministry of Finance pay this money also to Ghana Water.
Thank you very much.
Chairman, thank you very much. And this is to Ghana Water and Community Water, how are you able to authenticate the value of the estimated bills these suppliers submit to you? So here is an illustration. Ghana Water, you know that half of South9, we are not on your line. So we depend on open sources. You are now trying to intervene. Now, Safe Water supplies water to our people. It's not sufficient. During that period, they don't supply to the people as they used to sell. When they were selling, they were willing to open the tap until you don't find anybody at the standpipe. But when they were directed to supply freely, they now were supplying for like 1 hour, then they closed the tap. It became a major source for my people, but because we were all going through difficult times, we coped. But if they submit a bill, how are your people able to authenticate that when an entity says, I supply, for instance, 1,000 metric tons of water to these people, they actually did that?
Thank you, Mr. Chairman. That's why I said that the district assemblies are in these towns and villages. The district assemblies, they are the ones in these towns and villages with all these safe water network, the private water providers and all. So they will have to ascertain how much they did not CWSA. But I also want to make this point that we are
let me clarify
human.
that when they send a bill, we don't see it. We don't even know that a bill has been submitted and for how much. The people are not in a position to tell. An assemblyman is not in a position to tell. An MP is not in a position to tell. And yet a bill will be submitted to you that a certain volume of water has been supplied to the people for which, or estimated volume of water has been supplied to the people for which a bill is being demanded.
I perfectly get what you are saying, but sometimes it's difficult to deal with some of these issues. Yeah.
All right, that'll be all for the Ministry of Sanitation and Water Resources. You are discharged. So let's have, we are left with 2 more ministries to deal with, local government and transport. Clerk, can you swear them in? Local government and transport. Order, order, order.
Who is swearing? Who is doing the swearing? Who is doing the swearing? Hurry up.
I
Sebu Samuel,
do in the name of the Almighty God swear
do in the name of the Almighty God swear
that the evidence I shall give before this committee
that the evidence I shall give before this committee
touching the matter in issue
touching the matter in issue
shall be the truth,
shall be the truth,
the whole truth,
and
nothing but the truth.
nothing but the truth.
So help me God.
So help me God.
We'll take local government. Honorable Minister, introduce yourself to the committee.
Thank you, Mr. Chairman. Mr. Chairman, my name is Obi Amwa, Minister of State at the Ministry of Local Government, Decentralization and Rural Development. I'm still MP for Akuapem South.
Honorable Chair, my name is Kobrad Inchra, Director in charge of Human Resource of the Ministry.
Honorable Chair, the name is Dela Kemevo. I'm the Director General Administration of the Ministry of Local Government, Decentralization and Rural Development.
Honorable Chair, my name is Jama Aduma, Head of Internal Audit Unit.
Thank you, Honorable Chair. My name is Eric Minyele Banoyele, the Director of Finance of the Ministry. Thank
you. That's a nice name, eh? All right, so, Honorable Minister, you have 3 issues. The first one, paragraph 223. Honorable Ernest will take it.
Thank you, Mr. Chairman. So the infraction here is misapplication of COVID-19 response funds to the tune of 285,136. The auditors noted that 4.5 million Ghana cedis was allocated to the headquarters. And out of this, 285,135.64 were used for transactions that were unrelated to COVID-19. Some went into purchase of care things, some repairs of official vehicle, staff trainings, and others. The auditor's recommendation was that the Chief Director should ensure the refund of the total amount of 285,135.64 to the Auditor General's recoveries account. Can you confirm how much of this amount has been refunded so far?
Thank you, Honorable Chair. We can confirm that the total of 285,136 has been refunded.
Auditors, can you confirm if this amount has been recovered?
Honorable Chair, the outstanding amount has still been recovered. Thank you.
Thank you, Mr. Chair.
Thank you. Paragraph 230. Honorable Johnson.
Thank you, Chairman. Ministry of Local Government, you transfer a total amount of 200,000 Ghana cedis to local government services to expend on COVID activities. And an amount of 165,385.25 Ghana cedis was spent, leaving a balance of 34,000 Ghana cedis in the account. Chief Director were asked to recover this amount from this account and transfer to Auditor General. Please, has the money been transferred yet?
Thank you, Honorable Chair. The money has been paid to the Auditor General.
Please, can you confirm?
Honorable Chair, confirmed.
Thank you, Chairman. The money is being transferred.
Thank you. We have community development, Department of Community Development. Honorable Minister, is he under you?
Yes, technically they are still under us.
Okay, so there is one issue, paragraph 235. It's about misapplication of COVID fund, 17,051 Ghana cedis. So far, you are the ministry that has small. The recommendation is that you should get a refund of that money. Has it been able to do so?
Thank you, Honorable Chair. It has been refunded. Thank you.
Can auditors confirm?
Honorable Chair, the amount has been refunded into the Auditor General's account at Bank of Ghana.
Thank you very much, Honorable Minister. We thank you. That will be all for you.
Thank you, Chairman.
That's our Minister of Transport. Order. Kindly introduce yourself to the committee.
Thank you very much. My name is Mabel Sego, the Chief Director for the Ministry of Transport. And Honorable, we came with the Deputy Director, the Deputy Minister, Honorable Tampoli, but he's been called to the chamber. Thank you.
Thank you, Mr. Chairman. My name is Derek Watton, Head, Internal Audit Unit.
Thank you, Mr. Chairman. My name is Merlin Gaskin, Acting Director, General Administration.
Thank you, Mr. Chairman. My name is Mark William Atipo, Director of Finance, Ministry of Transport.
Thank you for coming. You have two issues. The first one, paragraph 276, Honorable Apak will take it.
Thank you, Chairman. Unaccounted COVID-19 funds, 18,500. According to the auditors, their review showed that on the 4th of April 2020, the Ministry of Finance released an amount of 200,000 through the Ministry of Transport to the Greater Accra Passenger Transport Executive, Ayalolo, to support its operation. They noted that even though the 200,000 was released in cash to Mr. Daniel Essel, the budget officer of the Ministry of Transport, only 181,500 was received by the private transport owners, leaving an unaccounted difference of 18,500. Have you been able to retrieve these monies back from Mr. Essel? And have you paid same to the Auditor General's recoveries account?
Honorable Chair, the amount has been refunded to, the amount has been paid to the Auditor General recoveries account. Thank you.
Auditors, can you confirm that the edited amount has been paid back?
Honorable Chair, we can confirm that the amount has been paid. Thank you.
Mr. Chairman, the amount has been paid back.
Thank you very much. The next one, paragraph 282, Honorable Akwesi Konedu. Honorable Bauer.
Thank you, Mr. Chairman. The said paragraph relates to unutilized funds. And per the narration, you were allocated an amount of 1.8 million to support your COVID-related expenses. And you allocated 1.3 to Metro Mass, and then 500,000 to Greater Accra Passenger Transport Executive, which is Ayalolo. But auditors are saying the amount that was advanced to Ayalolo could not be used because there was a court action or there was a garnishee order on the account of the Ayalolo bus transport. And so they could not utilize that money. And the auditors recommended that you should seek advice from the Office of the Attorney General on the way forward. Can you bring us up to speed as to the recommendations of the auditor, what you've done about it?
Thank you very much, Mr. Chair. So we had correspondence between the Ministry of Transport, the Ministry of Finance, so between us, the Ministry of Finance and Attorney General. And the garnishee, the case has been resolved, the garnishee has been lifted, and we've paid the amount to the auditor's recovery account. Thank you.
Auditors, can you confirm whether this money has been paid to the Auditor General's recovery account?
Honorable Chair, the outstanding 500,000 has been paid into the Auditor General's account. Thank you.
Mr. Chairman, the money has been refunded. That's all.
Thank you very much. That will be all for Ministry of Transport. You are discharged.
Thank you very much.
Thank you, honorable members, for enduring the long sitting for today. Minister of Finance, you are also discharged now. Ministry of Health, I've not discharged them, but they have all vanished. Tomorrow, I'm expecting Ministry of Finance again, Ministry of Health, then to clear those other issues. And then also, we are expecting some other ministries tomorrow. Ministry of Chieftaincy, Ministry of Education, Ministry of Information, Ministry of National Security, and Ministry of Energy to appear tomorrow to also account for their allocations, money disbursed to them. So we thank you very much for today. See you tomorrow at 9 o'clock in the forenoon.